We started on 16. Remember that question we started with?
16. You're gonna do question, you're gonna do two disease. Okay. So now read the question. Put on take off.
We doing number 16 right now?
Take her off speaker, please.
Oh, take off speaker?
Yeah. Okay. Can you? Okay. So number 16. So read the question one more time.
A 2-month-old infant has undergone cleft lip.
Go back and read it slowly so you could, grasp the question.
She texts back. She's not gonna come. She can't come.
It's okay. She don't have to come anymore. Okay. So let's go.
All right. A 2-month-old infant has undergone cleft lip repair, the use of which restraint would indicate that no additional intervention or encouragement is needed.
They give you the age is 2 months old. You understand? Mm-hmm. The age is 2 months old. So what else you want to underline?
I underline cleft lip repair.
That's it. You don't need cleft lip repair. Go ahead, underline it. That's your book. Yeah. Okay, so now I want you to know cleft lip repair. You need to know which population is more vulnerable to this. So now cleft lip repair information in clicks. So now you have infant, which is 0 to 3 months, but according to Board of Nursing, infant is 0 to 12 months because toddler comes straight after infants. So if toddler start at 12 months to 18 months, so you have a problem right there. So that's the reason I always tell people to do the diagram. Mm-hmm. The diagram is one line, 0 to 3, birth to 3 months is infancy. Mm-hmm. But birth to 3 months is infancy. But according to Board of Nursing, birth to 12 months could be considered as infancy because toddler does not start until 12 months. Okay. You understand? Mm-hmm. So now, because of that, I know it. I have it in my head. That I'm looking, if they're talking about infancy, I'm looking 0 to 12 months. But I know the correct answer is 0 to 3. Okay. But if Board of Nursing want to stress it, it will be 0 to 12 months.
0 to 12, okay.
Keep on, what about cleft lip palate?
Okay. Whether NCLEX focus on post-operative care for cleft lip repair. Use elbow.
No, darling. I want you to know what is cleft lip now. Oh. How that happened. Cleft lip NCLEX. That's how you do your questions. If you study this way, you should be able to pass your NCLEX.
It says it's a common birth difference where the tissue of the upper lip doesn't join completely during early pregnancy.
Stop right there. Stop right there, darling. What did you understand? If cleft lip.
So it has a trouble with the tissue of the lip that doesn't join completely.
Okay, now you're wrong again. Because you gotta tell me which tissues. They said it's the upper lip. That's the key word you need to understand. The cleft lip palate is the upper lip. The tissue does not join together. You understand? Read it again, my love.
I'm not getting anything for this, huh?
Listen to her. I'm waiting for you, Debbie. Read it again.
Okay, so it says cleft lip is a common birth difference.
Hold on, stop it right there. Put your note. Cleft lip is a birth defect. The Board of Nursing may ask you, what is it? It's a birth defect. Now you want to know what kind of birth defect. Read it again. My dear, read it again.
Debbie, are you there?
Okay.
Are you there, Debbie?
Femen la global. Debbie, chérie, bon de ti baol. C'est soit focus dans rivion bien.
I'm here.
Ou pas ka you here après lolo pas occuper personne
I
monde.
just came home from church and she was saying hi. I just want to run.
Jay-Z pas dire là déjà.
No, she just came from church.
Who's that?
My mom.
Jay-Z pas dire maman hi.
But she kept calling me.
Okay, baby. So now read about the cleft lip again. We know cleft lip is a birth defect. We continue on reading.
Okay, it happened in early.
Darling, go back. When you stop and you write something about a disease, whatever, you gotta go back and read all over again. Continue is not gonna help you.
Okay, so it's a common birth difference where
Darling, no, I don't know what you're talking about. Go read it back again.
It's a birth defect.
Go read it. What is a birth defect? You gotta repeat it. Cleft lip. Let's go.
Cleft lip, yeah, a cleft lip is a common birth difference where the tissue of the upper lip doesn't join completely.
Stop it right there. Now we know. Stop it right there. Right now we know cleft lip is a birth defect. It's the upper lip that involved, and we know it's the tissues in the upper lip who does not join together. That's it. That's how you study. Keep on going.
Okay, it says creating a split or opening that can range from a small notch to a large gap extending into the nose or gums.
Stop it right there. Now, we know, according to what they're telling us, we know cleft lip is a birth defect. And cleft lip, usually attacking the upper lip, where the tissues in the upper lip fail to join. And we know cleft lip could be a small gap. It could be a large gap that affected the gum and the nasal cavity.
Okay.
If you know cleft lip it's an upper lip that, so we know it's the upper lip defect. And then guess what? It could be a large gap. That large gap could affect your gum and your nasal cavity. Now, if you're smart enough, you don't need anybody to tell you. If you attack your gum, you could have problem with your teeth. Your gum. That's the structure that's all your teeth. Your gum. So if cleft lip could attack your gum, that means you may have dental problem. That it's not okay. You gotta understand it the way I'm telling you. Yeah, so if you attack your gum, what else you think? Okay, keep on reading. Please go back and read all over.
Okay, a cleft lip is a common birth difference where the tissue of the upper lip doesn't join completely during early pregnancy.
Hello. So now we know cleft lip happens during early pregnancy. So now what is early pregnancy? You need to know what is early pregnancy. Then is it within the first 3 months or the second trimester or the third? Usually it's between the end of the first trimester to enter the second. You're not gonna continue on reading. Please do not write.
Oh, so the child is born like that. Okay.
Go read it. Go back all the way and go read the questions.
Yes, a cleft lip is a common birth difference where the tissue of the upper lip doesn't join completely during early pregnancy, creating a split or opening that can range from a small notch to a large gap extending into the nose or gums.
So now, if he extends to the nose, what do you think will happen to this child?
Respiratory problem?
Of course, guess what? If the gum is involved, what do you think will happen? Feeding problems. Because if the child tries to swallow, he may come out of his nose. So you got to understand the disease. You understand?
Yes.
Now, let's go back to see. They said it happened in early pregnancy. Now we want to know, as you know, how early it is in the pregnancy. Now, cleft lip happen in early pregnancy. Happen when? NCLEX. Cleft lip happen when? NCLEX. One question. If you don't take 30 minutes and one question, you don't know your shit.
NCLEX. Because what happens when I cut NCLEX? Okay. It says usually between weeks 4 and 7 of gestation.
Okay, I want you to go back and read it because I don't understand.
It says very early in pregnancy.
Clefts would happen very early in pregnancy, specifically when the facial tissue forming the upper lip failed to join completely.
That's not what I'm asking you, darling. You're wrong. I'm asking you when.
It says very early in pregnancy, usually between weeks 4 through 7.
That's it. With 4, that means he happened in the first trimester. In the first trimester. That means in the first 3 months.
Yes.
Okay? Cleft lip usually happen in the first 3 months. I don't care if the board of nursing saying it's 4 weeks, 3 weeks, first 3 months, period. Because they said from weeks 4 to 7. You understand? In the first trimester. The first trimester. You understand? Read it again so we could understand it.
Yes.
Cleft lip happens very early in pregnancy, usually between weeks 4 through 7 when the facial tissues don't fully join.
Cleft lip happen. First of all, put cleft lip happen. Hold on, happen. Put 1. No. Second line. 1. Early in pregnancy. 2. Week 4 to 7. Happen in week 4 to 7. 3 in the first trimester. Period. You see how you study? You see how you understand what they're looking for? Yeah. So now, you know, if the board of nursing said, oh, wait, the cleft lip happened, the mother will say, what happened? The doctor will say, this deformity happened in your child upper lips in the first trimester. Usually happen in the first 4 weeks to 7 weeks. And usually, you could repair it. Now, you want to know how they're going to repair it. Cleft lip repair. Google cleft lip repair and NCLEX, please. Cleft lip repair and NCLEX, because I know it's a 2-stage surgery. Let's go. So now, after that, you're going to look a picture of the cleft lip to get a good understanding.
It says NCLEX topic of cleft lip repair. Timing of repair. Cleft lip repair scioloplasty is typically performed when the infant is 2 to 3 months.
Stop right there. So now you know for cleft lip repair they do scioloplasty. So now read it again. Cleft lip, put your title. Cleft lip repair. Big title. Hold on, darling. Hello, hold on, please. Cleft lip repair. Okay, so now when do they do cleft lip repair? This is what you need to find out. They do it when? Darling, please do not write.
Okay.
When do they do cleft lip repair?
2 to 3 months old.
Darling, read the whole thing again.
Oh, okay.
I'm not going to tell you again.
Okay. Timing of repair. Cleft lip repair scioloplasty is typically performed.
Okay, now I want to stop you. What is scioloplasty?
Okay.
Go look for, skip a couple lines, put scioloplasty there.
How you spell scioloplasty, Debbie?
CHILOPLAST.
Oh, okay.
Okay, scioloplasty. If I was you, I would put an arrow and said procedure to repair cleft lip. That's one of the procedure they do. Okay, shioplasty. So now, tell me what they do. Shioplasty, what they do. Now look for shioplasty NCLEX. You don't study not, because let me tell you, the question will come from left to right. What they do. Shioplasty, what they do.
1 second, I have to Shioplasty NCLEX. NCLEX, oh yeah, NCLEX. Okay, Shioplasty NCLEX. Shioplasty cleft repair. It says Shioplasty cleft lip repair. Content on the NCLEX focuses primarily on post-operative nursing care and family education, particularly managing the airway, protecting the surgical site.
Stop right there. Why they said your goal as a nurse is to manage your airway is because they tell you when the patient have the kids born with that cliff flap, when they're born with it, usually is a small or big gap. The gum is involved, your nasal is involved. Your primary source of oxygenation is your nose. So when somebody breathes through their mouth, it's only infant. Adults that breathing through their mouth, they have conditions. It's either the COPD, asthma, they have some lung issues. Only person that allowed to breathe through their mouth is the infant. No one else. So now, because they told me the lip and the nose is involved, I know they're not getting enough oxygen. I know I need to put them in a certain position to feed them because the nasal cavity is affected and the gum is affected. And guess what? The fluids may not going down properly. They may end up with pneumonia. They may end up with, certain conditions that I don't want. So now, they do a cleoplasty to repair the lips. And what else they will do? Read all over, please.
Do you want me to read it over again?
Over, darling. That's the way you learn.
Okay. Shioplasty cleft lip repair. Content on the NCLEX focuses primarily on post-operative nursing care and family education.
So now, hold on, stay right there. Post-operative. Put your title, post-operative. Let's say the patient, okay, at what age they do that? What age?
2 to 3 months old.
How many surgery they supposed to have? Please do not read. How many surgery? They do it in 2 types of surgery now. Okay. Post-operative, no, now you're going to put there cleoplasty. Usually they start doing the procedure when the patient is like 2 to 3 months, right?
Yes.
Okay, now 2 to 3 months, 1 month is 30 days. So 2 months is 60 days. 3 months is 90 days. The board of nursing will come with the days. They don't come with the months.
Okay.
The board of nursing will tell you, oh, how many days? 2 to 3 months. Between, you're going to look your between now. Between 2 months, which is 60 days. 2 months is 60 days
60 days, I'm sorry.
to 90 days. Okay. Put that down. 60 days, 2 months, 2 to 3 months. Put 2 months. They do that operation. 2 months to 3 months equal 60 days to 90 days. So because if the board of nursing shoot 60 days, I know what they're talking about.
Okay.
They're not going to do with weeks. They don't do weeks. Okay? So let's go. Keep on reading, please.
It says post-operative care and
Debbie, I'm not going to tell you again, darling. I want you to read all the information over. I'm not going to tell you again.
Oh, okay. Oh, you want, okay.
Because you don't want to make the money. I'm already making the money. I will hold the hat. So now I want you to make the money to bring me big gift. So let's go.
Okay. I want to join you making that money.
Yes. That's it.
Okay.
Let's go.
Geoplasty cliff lip repair content on the Anntwip focuses primarily on post-operative nursing care and family education.
Hello? Stop right there. Could you imagine you have a child? Could you imagine your new mom? Could you imagine you expecting a healthy baby? And then when your baby born, you find a big gap in the upper lip. And this is, you're going to be depressed. So now the doctor was giving you hope, stating that we could repair that, but you're going to have to live with this baby like this for 2 months to 3 months. Because the repair, usually they do it between 2 to 3 months. For them to do it between 2 to 3 months, the baby has to be healthy. So now you have a guilt. You said, why me? Why I'm in that situation? Your job as a nurse is to teach. You teach prior and you teach post-op. Prior, yes, I know how you feel, but cleft lip repair, usually we done that between 2 to 3 months. And guess what? I'm not going to tell you everybody else successful, but you have a big chance. And your baby will look normal. If everything went as planned. So that's the post. After, you need to tell them how to feed the baby, how to hold the baby as a football, how to feed the baby, how to burp the baby. Importantly, for this patient who have a baby with cleft lip, education is the key. Let's go. Read it again.
Okay, so geoplasty cliff lip repair content on the Anntwip focuses primarily on post-operative.
Post-operative, that's your focus. Let's go. My job, you just put in your note. My job as a nurse, post-cleopathy. Your job. Okay, so now read it so all of us could understand.
Okay, post-operative care and cleft focuses. The primary goals are to maintain a fit and airway.
Stop it. The primary goal, if you look your ABC, is airway, because the gum is involved in the nose. Your primary, how do you get oxygen to your body? Is through your nose. The only person who could bring oxygen to the body through their mouth, which is not any contraindication, is not a disease, is infant. After that, any big gum will like, that's a problem. Let's go.
Can you repeat that again, Debbie?
Okay, the primary goals are to maintain a pit and airway, protect the surgical.
Why do you think they want to maintain a pit and airway? Why? Debbie, why?
Because
the nose is involved, darling. The structure of the nose is involved, and your nose is a primary oxygenation site. Inhalation occurs in your nose. That's the reason. You understand?
Yes.
Okay, keep on reading it.
Yes, the primary goal are to maintain a pit and airway, protect the surgical site, and prevent complications.
How are you going to protect the surgical site? By doing what?
In positioning,
Darling, protecting the surgical site. You want to make sure everything is sterile when you do the dressing. You want to wash your hands. You want to use clean gloves. You want to remove your dirty gloves. You want to put your sterile gloves to do your dressing. And you want to make sure you look for sign of infection. What is your sign of infections? Redness. Darling, please. Redness, swelling, pain at the surgical site is infections. Redness. Listen to this. Hello? When you inspect a surgical site, you go to the patient. You touch. First of all, before you touch, you look. You see redness. You look, you see swelling. You touch his pain, is infection. Period. That's when you get the doctors involved because it's a surgical site. And then the last thing you're going to do is your temperature. If the patient has a fever of 101, greater than 101, is infection. Do you understand how to study? That's all I want you guys to do. Next week, I'm not going to be here. I'm showing you guys how to study now because in the next 3 weeks, you're going to take your exam. There's no but or if. Be focused. Okay. Do your due diligence. Okay. So let's go. Keep on reading, please.
And the primary goals are to maintain a patent airway, protect the surgical site, and prevent complications.
How are you going to prevent complications? By showing the mother how to feed the baby. So now I want you to go and look. How do you feed a child with cleft lip palate?
You said protect the surgical site and do what? I'm sorry.
Patent airway.
Prevent complications.
Oh, prevent.
You prevent complications. You're going to prevent sepsis. You're going to prevent infections. You're going to prevent of your patient going back to the... Okay? So now, we still in... Okay, so now you want to know... You're going to teach. Now put teaching. Keep a couple like... Darling, keep ton cap... Mettez... Just en bas pour écrire. Teaching, please. Okay. Teaching. So now you want to know someone who have cleft lip repair, how the mother should teach them. Cleft lip repair. Because they already do the repair. Now you want to know how they're going to feed that child to prevent aspiration, to prevent complication, to prevent infections. Let's go. Cleft lip, darling, look, cleft lip repair in clicks. Darling, please. Darling, I'm going to ask you one more time. Take your time. Cleft lip repair in clicks. Cleft lip repair management in clicks. Okay? Let's go on so.
Management.
Yeah, because you know, you're a new mom. You don't know what to do. Remember, there's a hole between the lips and the nose. Prior, you need to know both. Before the repair, are they gonna feed them? After the repair, are they gonna feed the baby? Before repair now.
Before surgery. Use special nipples.
Go ahead.
For example, lamb's pigeon feeder or a septo syringe to provide breast milk or formula, aiming the nipple away from the cleft. Appliances, lip taping or nasal alveolar molding.
Darling, please, you're in the wrong place. What do you have, Debbie?
Okay, I have assessment, ensuring the infant is healthy and gaining weight.
Darling, that's not what I'm asking you. I'm asking you to tell me before, when you a new mom, and ou get petit ou qui vini avec nail coupé, bouche coupé, prior to surgery, parce que va faire surgery, les faire surgery c'est sous 2 ou 3 mois. Comment m'a feed li? I want to know. Prior to lip repair, cleft lip repair, How do I manage my daughter or my son? Darling, what are you looking for?
It says
Darling, what are you looking for?
cleft lip repair management.
That's not what I asked you. Because you know what? You need to know the prior before the surgery.
Okay.
How you gonna teach the mother? You have a child, bouche coupée, nail coupé, tout le monde fait en forme pour la fête des formes.
Okay.
Yeah.
Cleft lip repair.
Darling, please. Self-esteem. Your self-esteem is down. You could be depressed. Because everybody have a healthy baby. I don't. So now, as a nurse, hello please. As a nurse, you must be able to tell the mother they could have the repair within 2 to 3 months. But before that, if she asks you, how I'm going to feed that baby, li pa gen good sucking because la coupe, the upper lip is split. There's no big sucking. It cannot suck, you know. So if the baby cannot suck, what you gonna tell them? How are you gonna feed the baby? What position she's gonna help the baby to?
Okay.
Post before the surgery, 2 to 3 months before the surgery, how she's gonna feed that baby? Debbie, I'm asking you not to handicap throw kakala, please. Take your time and look. I'm telling you now. Because I'm asking you, sous c'était ou même ou bien ou famille ou, qui gon fait font bébé, jolly coupé, nail coupé, li gen cleft lip, yo pas ka faire opération pour li until 2 to 4 months or 3 months, qui jan pour le feed li, qui jan pour le kembel. C'est ça m'mando. Pour pas gen malnourishment, parce que faut le manger. Okay? It go on to know.
So I have some, it says feeding techniques and aid before surgery.
Mm-hmm.
Special bottles. Use bottles with cross-cut nipples or special.
Stop it right there. So, stop it right there. Ça veut dire before surgery, n'a use bottles qui ka di bottle?
Cross-cut nipples or specialized cleft nipples that allow for controlled flow.
Et ou même qui sont jeunes même. Chérie, si son écrit, c'est
Okay, it says.
moun ba kon écrit comme ça, non?
Okay. Feeding techniques. Use special feeding devices like specialty nipples,
That's it.
those with wide base, one-way valves, or extra length to help the infant achieve a better seal and control milk flow.
Okay, so now, is it before or after?
This is before. Maybe.
Read it again for us.
Use special feeding devices.
Darling, est-ce que c'est before? Pas grand yon di me wap di me use. M'pa kap use si m'pa kon salye. Is it the answer before or after?
Feeding techniques
Before when? We're talking about
prior to cleft lip surgery.
prior. That's a prior to cleft lip. Ki bado on a pu utiliser, s'il vous plaît.
Use special feeding devices like specialty nipples, those with wide base, one-way valves, or extra length
Prior, that's a prior
to help the infant achieve a better seal and control milk flow. Positioning. Feed the infant.
Darling, what do you understand? Not tout chose di nan la.
The bottle has to be
Darling, please. Ki le bado a supposé kon sa?
before
Before, ki kalite bado bezwen?
wide base specialty bottle.
Okay, what else?
The specialized cleft nipple.
Special cliff nipple.
Special clip.
Hey, kon kesyon nan state board la isal di.
Oh, special clip.
Nipple and special wide base bado. Koman wap kebe ti moun nan? There's a position. Is it a football? He has to be in a football position.
Okay, it says keep the baby in a semi-upright
Hold on, my love.
position.
I don't want to hear that. I want to know if it's before or after. So I'm raconte m nan bakone.
Okay, yeah. Feeding technique and aids before surgery.
Before surgery.
The surgery.
Mm-hmm.
It says upright position.
Upright position. 1. Hello, please. Hello, please. 1. Upright positions. 2. Gen lo position que football. Ou pa la moun yo kebe football la wal voye ballon. Ou pa comment kebe? Football positions. That's 2. And what else?
position.
Cradle.
Cradle position.
Cradle position, that's third. And what else?
That's all I have.
Okay, so now you know the baby should be in an upright position for what, Debbie?
For feeding.
That is to prevent what?
Aspiration.
To prevent aspiration.
That's it.
Mhm.
Continue. Okay, now we want post-op now. Post-op. Look for your post-op, darling.
Post-op, where are you?
Love. Post-op.
Post-op, where are you? Post-op. Post-op after surgery. This is a lot of information for this thing.
1 second. Hello? I'm in the class.
Okay. Yes, darling. Post-op position. Post-op now.
Shoot, I'm sorry. I didn't realize I hung up on Debbie. Okay.
Hi, Jounen.
Sorry, I hung up by accident. Okay.
Okay, Debbie. Post-op now, we want to know what we do post-op.
Oh, we can hear if she's on the
Okay, go ahead, baby. Sorry. Post-op. Post-op now, after the surgery, we're expecting to teach the mother what to do, and also if we have a student nurse or a brand new nurse in orientation, we are the mentor, we are the leader, we also are the preceptor. We have to be able to tell them after that surgery what to tell the mother. What do we do now?
Okay. Post-operative management nursing focus.
And what?
On the cleft lip.
Darling, if you don't say it, I don't know what are you talking about.
Okay. On post-operative management nursing focus on cleft lip repair. Immobilization. Use a soft elbow restraint.
Okay.
Remove.
Okay, why we using a soft elbow restraint? Why?
So,
Picture your elbow. I don't want you to tell me. I want you to picture your elbow. I'm going to immobilize my elbow. Why?
So the baby doesn't.
Darling, look at your elbow. The answer is in you. Immobilize it. When you put something here, you cannot flex. What does that tell you?
So the baby can't
touching.
move.
You can touch the surgical
That's it. When you can move,
baby.
you cannot touch the surgical side. Because if I immobilize your elbow, you cannot reach your mouth.
Yeah.
Period.
Okay.
If you put a meat ant, they still could reach the mouth.
Yes, yes.
Okay, let's go.
Okay.
Go read all over again, please.
Post-operative management care nursing focus for cleft lip repair. Immobilization. Use soft elbow restraint. Remove every 2 hours to check skin.
Stop. Hello. When you use the immobilized elbow restraint, as a nurse, your job is to assess. You do not send the PCA, the CNA, the LPN. You, the RN, you assess. Because assessment only done by RN. You're going to remove, hello please, you're going to remove the restraint, the soft elbow restraint you put. The reason when you put a soft elbow restraint, look. You tape it, can I? Ben, I can't. I need to remove it to check circulation, to check the skin, to see if there's any skin breakdown. Every 2 hours. Let's go.
Okay, post-operative management care, nursing focus on cleft lip repair. Immobilization, use soft elbow restraint to remove every.
You want to listen to her or you want to read? Because let her finish, you could read your own.
Okay.
Okay.
Yeah, not to allow sucking to prevent.
Why you not allowing sucking?
Because of the suture.
Hello? Not why you not allowing sucking?
Because of the suture from the...
Complications.
Darling, read for me. You're not allowing sucking. Why? Darling, keep on reading. It's there. The answer is there.
To prevent touching the surgical site.
Darling, read the whole thing over, okay?
Okay. Post-operative management, nursing care, cleft repair. Immobilization. Use of elbow restraints. Remove every 2 hours to check skin. Not to allow sucking.
Why you not allowing sucking? So now, picture yourself in an elbow restraint. That's all I'm asking you to do. Mets ton bout de bois dans elbow. Est-ce qu'on peut bénir no? Pile si mon sock des thumb. Ou yo pas ka mette douette yo dans bouche yo. Okay, let's go.
Okay. To prevent touching the surgical site.
Yes, parce que mais on pas jamais river, c'est elbow. Soumet ton mi-tête, la briver. Soumet ton restriction, la briver. The elbow they cannot flex. They cannot flex. Ça vous voulez écrire maintenant? Post-opération, ou mettre un soft elbow restraint, ou y why to prevent sucking, why to prevent complication on the side, parce que ça cause infection by moyen. Let's go.
Site. Okay. What about, did it tell you about the sleep position? Over here it says.
You gotta read it, darling.
Okay.
Post-op, what position you put them?
Always have the baby sleep on their back in an infant seat, never on their stomach or side to avoid pressure on the lip.
That's it. Now you know, patient sa, si moun sa met dem coucher, back or side.
Yes.
Not non fascio, parce que pas mettre pressure. And guess what? What is the best position to put babies to sleep?
On their back.
To prevent infant death syndrome.
Yeah.
What else you gonna remove from the crib? Hello?
The pillow.
The pillows. What else?
No.
The comforters. What else? The stuffy animals.
Yeah.
What you gonna put for game for them? The thing that dinging. What do you call that? Cap vire en l'air. Bagay wait on like a vire mobile, but he has to be hanging on the ceiling.
Yeah.
Not on the crib.
Okay. Yeah.
Okay. So let's go. We're gonna move to the question back with the question one more time. Thank you.
Okay. A 2-month-old infant has undergone cleft lip repair, the use of which restraint would indicate that no additional intervention from the charge nurse is needed.
A.
Elbow. B, mummy. C, jacket. And D, clove hitch.
Okay, so now, the only thing I think you don't know about all those restraints is a mummy. Google mummy restraint. Mummy restraint is when you put a patient in their back and then you kind of seclude them. Mummy restraint. You don't need no mummy restraint. So go to mummy restraint and see what mummy restraint look like. Look for a picture. Mummy restraint, look for the picture. Now, next to mummy restraint, when you see the picture, now you visualize it, you're going to know why you're not going to put it.
carrying the...
That's it, but they do it in a different way. Let me see your mommy restraint. Yeah, but you don't do mommy restraint for cliff palate. Next to you, the questions. You see mommy restraint?
Mm-hmm.
You see it?
Yeah.
Put not for cleft lip. You gotta remember it. That's the way you study. What is the next restraint we're questioning now?
Jacket.
Jacket. Look for a picture of the jacket restraint. What is it? The jacket, what is it?
This one.
Why would you want to, if you put the baby in a jacket restraint, what do you think will happen? Hello? If you put the baby in a jacket restraint, what do you think will happen? Just had surgery.
The arm,
Darling, please. What do you think will happen? Remember, it's cleft lip palate. What involved? What involved, darling?
the lip,
And what else?
and the nose.
Okay. You put somebody, what position you need to put that patient? Upright position, right?
Yeah.
If you put them in a jacket position, what will happen? If they're bleeding, what's going to happen? They're going to swallow all those blood and they're going to aspirate. Yes or no?
Okay.
Okay.
Yes.
Not for cleft lip. So now, I want you to look and tell me who you will put on a jacket restraint. Look, who you will put.
An adult.
Darling, please look it up. Adult, keep it up, my love. If I was you, the best way to do it, hello? Cleft lip palate and a jacket restraint and see what they said.
It says for those posing immediate or serious harm to themselves.
That means it's for adult, for people who's vicious, who's dangerous. What is the next restraint, please?
Clove hitch.
Look for clove hitch restraint. What is clove restraint?
It's after cliff.
Darling, please do not read it to me that way. Tell me what you're talking about, please, okay?
Yes, the cliff lip palate with jacket restraint. It says after cliff lip or palate surgery, jacket restraint, arm splint, or used to keep a baby hands away from their mouth, preventing them from disrupting the healing surgical stitches, typically for 2 to 3 weeks.
That's what you got for clove hitch? Did you look up clove hitch restraint?
Clove hitch?
The next one, D, clove hitch. That's what we're looking at.
Every answers you have to look to see why is not good for your answers when you find the right one. What is the correct answers in this? Go look at the answer for me, please. What is the correct answer in this?
Elbow.
Look it up. Remember, we study is the elbow. The restraint, the recommend is the elbow. No mitten. Because mitten, it could go like this.
Yeah.
Jacket, the hand still free. If you guys are studying this way, it's not gonna work.
No, we've been looking, but that's what we're doing.
You should.
Okay. 16. Answer A. Elbow.
Of course. Why now? I want you to read the answer there. Why is A? Why is elbow?
The elbow restraint will prevent the child from touching the surgical site without hindering movement of other parts of the body.
Nah. So now you see, put the restraint on your elbow. Look, put a book on your elbow and tape it. View. Can you move? No. The elbow restraint, the child will not reach the surgical site.
Yeah.
You don't need no mitten because mitten they could still go like this. Jacket, the hands are free. The only thing you want to prevent is for them to reach the surgical site. Okay. So now do you have an understanding of that?
Yes.
Okay. Next question. I'm gonna move on. Next question, please.
17. When providing care for a client with trigeminal neuralgia,
This is tic douloureux. That's what you call it, tic douloureux. So, yeah, that's tic douloureux. Okay, so now, if you did that question, you should have answered what is tic douloureux. Tic douloureux have 3 compartments. What is it? So now, look for tic douloureux, sign and symptom. I don't know how you guys did the questions, but this is not the way.
Tic douloureux.
Darling, tic douloureux and clex, okay?
Okay. Tic douloureux.
Hey, Debbie, you have it?
Yes, I'm there. I just have to put NCLEX next to it.
Okay, read for me, my love.
Tic douloureux NCLEX. Trigeminal neuralgia on the NCLEX involves recognizing sudden, severe facial pain.
Tic douloureux, period, is a facial pain. I don't care what people said. When they talk about tic douloureux, germinia, whatever you call that, is a facial pain.
Severe.
Keep on reading. Darling, please keep on reading.
Recognize
Go back.
the tic douloureux NCLEX. Trigeminal neuralgia on the NCLEX involves recognizing sudden severe facial pain.
Stop. They said people who have tic douloureux, they could be sitting at the table and suddenly they have pain coming out from nowhere. Sudden facial pain. That's not something they experienced before. That's something that come out of nowhere. That's tic douloureux. Read it again.
Tic douloureux trigeminal neuralgia on the NCLEX involves recognizing sudden severe facial pain, electric shock-like.
Stop it. So now, if the board of nursing tell you Marie Senat have like shock pain in her face, what do you think it is?
Tic douloureux.
So read the question. Read the answer.
Tic douloureux trigeminal neuralgia on the NCLEX involves recognizing sudden,
which is acute. When they said sudden, is acute.
severe facial pain, electric shock.
Electric shock. The person feel like, he just prend courant. Okay, let's go.
Often triggered by touch, chewing, identifying nursing priorities.
Stop right there. So now, let's go. Put your title down. Put your phone down. Title, your tic douloureux. Tic douloureux, your title. Also known as, what's that making? Also known as what?
Trigeminal neuralgia.
Mi, le mwen te nan nursing school, pou mte sonje trigeminal sa mani tria. Parce mi 3 bagay la don.
Okay.
Mani di tria, tic douloureux tria. Parce 3 things is involved. What is the 3 things? Go back and read it. Parce mba ka sonje nan kon sa.
Recognizing sudden.
Darling, please read it pou mba kon sa recognizing nan bakon de ki so pale mon amour.
Tic douloureux trigeminal neuralgia on the NCLEX involves recognizing sudden severe facial pain, electric shock like, often triggered by touch, chewing, identifying nursing priorities like pain management.
Okay, so now try generalize what does that mean? 3 things: facial pain, touch, and what else? What else, darling? You fait l'île faut qu'à dire nous.
Sudden severe electric
Facial
shock.
pain and what else?
Sudden
Nutrition and hydration.
What nutrition? How ça parle de
touch and chewing. Often triggered by touch.
chewing and facial pain. That's it. Tic douloureux, ça mon absenti, facial pain. L'homme est bon figure l'homme touch. And Lord, la brasse diol l'homme chewing.
Okay.
Tout le temps, on va faire question comme ça de votre machine.
Electric shock like.
Let me go back to you, my love. Ou pressé pour écrire Tintin?
No.
Yo do tic douloureux, combien c'est homme tic douloureux gagne? Pas ça mando, chérie pas regarder. Combien c'est homme gagne?
Facial pain.
Combien c'est homme pas mando?
3.
Okay. What is the m'pa pas avoir Debbie? What is the 3 symptoms?
Facial pain, touching, chewing.
That's it. So now, we're supposed to écrire tic douloureux symptômes. 3 symptoms. Facial pain.
3 symptoms.
Darling.
Facial pain, chewing, touch.
That's it. So when you ask your mother what kind of pain is a shock-like pain.
Okay.
This is the describing of the pain. Parce que ça doit constater sensation électrique au choc qui prend en figure. So, puisque on dit moun ça a un problème, facial pain, chewing, and touch, ou pense si moun ça bosse dans les problème? Yes. Parce que you do chewing, là ouvert diol ou bosse ça li. Moun ça qui qualité manger ou bal manger?
So.
Est vrai?
Liquid.
Donc d'après, ou bal yo manger qui est room temperature pour pas saisir bobek li. Mais comment tu non?
Oh, it just
Pas écrit non?
it says education triggers washing face, brushing teeth,
Aïe aïe aïe.
talking.
Aïe. Parce que les moun n'a parlé, les getik douloureux, elle a parlé, n'importe si vent frais qu'entrer douleur prendre. N'importe mouvement le fait douleur. Go read the whole thing.
Okay. Tic douloureux, trigeminal neuralgia. On the anklets involve recognizing sudden, severe, facial, electric shock-like, often triggered by touch, chewing, identifying nursing.
Stop it right there. Est-ce que les températures involvent là-dedans?
No.
Okay, keep on reading.
Nursing priorities like pain management, ensuring nutrition, hydration, maintaining oral hygiene due to triggers.
The reason they said that is because you're dealing with 3 symptoms. Touch, chewing, and facial pain. Ça veut dire moun qui est tic douloureux à moins figure, douleur dans mon dal. Li chou manger douleur. Si m'pa ka chou pou m'vale, m'a dehydrate. Si m'pa ka chou pou m'vale, m'a gain loss of weight. So this affair do watch bagay sa. Let's go next. Continue reading.
Key medications for tic douloureux. Anticonvulsants like carbamazepine, oxcarbazepine, and treatments MVD.
Darling, read it again, but swap sugar avel. Kunya skip a couple line, put treatments. Couple line, darling, keep okay. Treatments for tic douloureux.
Okay.
What is the treatment for tic douloureux?
Okay.
Darling, put treatment for tic douloureux in Clex, please. Et samedi, on m'appelle des dîners comme ça pour nous faire ou écrire Tintin. Lori jwa ekri tenten nan page baye moun yo.
Treatment.
Treatment for tic douloureux and clex, my love.
Okay.
Ti médicament wè ap utilize pou li?
It says focus on for tic douloureux trigeminal on the ankles. Focus on
Carbamazepine, which is what?
It's a drug of choice.
Is that neuropentin?
They have gabapentin.
Gabapentin, sorry, it's gabapentin. So now I know for tic douloureux they're gonna use gabapentin, also no gabapentin, which is no 110. Darling, please, gabapentin, which is no 110. You treat tic douloureux with gabapentin, also known as no 110. Darling, please, when do we kiss up with you?
No, I see the
Darling, keep on going. Let me finish. Gabapentin also knows as no 110. Okay, so now continue and reading. Est-ce qu'on met des treatment for tic douloureux dans tête li?
Oh,
Yes.
Treatment for tic.
Ou elle me dit nous ne pas ap courir pour examen?
Yeah. No, I might
Okay.
change my date.
Keep on reading. Ou bet changer de tou chez ou on aller. Et papa non? Ou peut qu'on comprenne sens là, qu'on y comprenne sens là. Après au fin font 100 questions comme ça, ou tellement pas trop parler.
Okay.
Mais comment ça? Si ou courir et comment faire faut me connaître qui ça disease là why it's faut me connaître as a nurse what is my teaching responsibility. As a nurse from Corneille, why the resident prescribe this?
Okay.
And I know this is not the medication.
Okay.
Let's go. Read it again.
For tic douloureux trigeminal.
So gabapentin.
Gabapentin.
Mm-hmm.
Oxcarbazepine, noting anticonvulsants are key surgical options.
So now I know. Second, anticonvulsions. Second, mettez anticonvulsion. Anticonvulsion usually is Dilantin, Keppra, all of the anticonvulsion. Dilantin, which is phenytoin. Put Dilantin for me. Say you know medicament you buy.
Phenytoin?
Phenytoin, which is Dilantin.
Oh, okay.
Phenytoin, which is Dilantin. They may give Keppra.
Phenytoin. Keppra. It says microvascular decompression.
Darling, ne pas ça regarder qu'on regarder médicament. Mettez toi en place pour pas focus by où est le
Okay. For tic douloureux.
You can buy carbamazepine.
Carbamazepine.
You can buy Dilantin. Put your carbamazepine. Carbamazepine. You know your phenytoin, which is Dilantin, and your Keppra, which is levetiraxone. I don't remember the name. Cherchez the other name for Keppra, please.
Okay.
Keppra, I think it's levetiraxone, whatever you call that. God. The other name for
levetiraxone.
that's it. So that means put Keppra, also known as levetiraxone.
Okay. It says key for NCLEX prep for tic douloureux trigeminal. Focus on anticonvulsants.
Dans les balles, mais avant nous médicament, pas comment faire vivre quand il là, il a médicament y. Ou qu'on médicament?
Okay, I couldn't study more.
Non. Bonjour. Study more, pas menon quand on vivre, c'est no more qui menon.
Okay.
So now we know tic douloureux, moun ta gen on study douleur nan figure. Moun sa dit comme ça que même dans l'el brosser le saisi et le bread l'eau glacée le saisi même ba là oui. Moun sa dit comme ça non seulement de bon moun toucher bon figil, il go crazy. Il pas ka brosser dedans, il pas capable moun pas ka touch figil et il fait là que peine nan son peine qui te kon là comme moun qui prend courant.
Okay.
3 things. Make sure on 3 things. Parce que board of nursing parle de comme ça que déterminer qui 3 things ça qui dit c'est tic douloureux. Il y a mis des 2, il y a mis dans l'autre là 2, il y a mis dans l'autre 1 et puis troisième non on va jouer tous les 3 et tous les 3 pour chercher. OK? Et ben non, chérie, on non l'autre monde Wisdyne.
Oh, no, I'm saying if they give us
Pas c'est l'école et pas parler de c'est l'école de la voilà parce que ce qu'on a fait c'est l'école de la pas qu'à faire.
Okay.
So combien ça gagne dans tic douloureux?
3 symptoms.
Yes, oui.
Facial pain, touching, and chewing.
That's it. That's all you need to know. And then, moun sa, pour qui ça qu'on pense, y a traité moun sa avec anti-conversions. Why? Where is your brain? Kote brain ou ye?
In pain.
Kote brain ou ye, chérie, nan ki pati brain ou ye, nan mouda ou bien nan tête ou? That's it. Parce que depuis brain ou nan tête ou, li pa ka prendre douleur ça. Brain ou après réagir, la dit what the fuck is wrong? Et puis là, à top! C'est ça fait besoin que mes brains ou non lèvres qui flat. C'est ça fait ou vle ba ou anti-conversion, your phenotone, your caprin, your carbamazepine. Phenotone, which is your dilantin.
Okay.
Phenobarbital. They could even give you phenobarbital. Put your phenobarbital. Also phenobarbital. Bitol. Yo kaba ou tout c'est pour seizure. Parce que Brennan dit là, m'pas comprendre ça qui passe même on a bossé dans mon hyperactivated. Même on a mon figure moi hyperactivated. So they need to calm the brain down. If not, you're gonna have brain damage. You're gonna have seizure after seizure, seizure after seizure. They will not know what to do. Let's go next. Okay. Ça gagne que mais qu'est busy ça gagne. C'est quoi ça pour faire question? Soit faire question pourri. Il y a petit loin parce que l'arrive au jeune même question ça dans différents langages pour que je réponse ça. OK, tic douloureux. When you have your nursing responsibility, that's the doctor's responsibility to prescribe medication. Please stop, listen. The doctor's responsibility is to prescribe medication. The medication is going to prescribe is an anti-conversion of phenotone or your dilantin, which is dilantin, your carbamazepine, and also your phenobarbital, your Keppra. That's the doctor's responsibility. I cannot administer it until I have an order. Now they want to know, how do you contribute with the doctor? I'm going to tell the doctor, the patient told me she has a certain pain to her face. Is it both part of the face? Now, c'est là pour donner simple. Usually where the tic douloureux, put tic douloureux and both sides of the face or one side. Mais donne nan de non pour nous répondre question. Nous va venir pour trouver chèque là bon même tout non. Pas faut nous wash juste va connaître.
Nursing responsibility?
Chérie, pas ça m'a non? Moi m'a pour garder. Est-ce que l'organe moun nan get tic douloureux c'est both sides of the face or one side of the face? Parce que la part of the face il va pour l'autre côté encore. Tic douloureux atteint both sides of the face or one side of the face? Debbie, répondre question moi d'abord avec Paul.
Okay.
Okay, hold on. Debbie, ou m'attend oui?
Yes, I'm here. Hold Okay.
Is it both sides of the face or one side of the face?
No, one side.
Aïe, aïe, aïe! Tic douloureux is one side. When it's both sides of the face, c'est on l'autre ici et on va le saper devant.
Okay.
Tic douloureux, it's one side of the face. Parce qu'il y a trois problèmes. Il y a problème touching, chewing, brushing. Il y a problème est-ce que le problème au smiling, s'il vous plaît?
Yes.
Qui boit ça? Ever? Est-ce que le problème au smiling? Qui boit ça? Kounya mwen vle wa li tic douloureux. Aso a mette écrit dans deux pages ça, essayez deux pages de faire. OK, écrit là review tic douloureux pour moi s'il vous plaît. Aso c'est de voir ça. C'est où pour faire tête ou chérie, c'est où pour sortir dans son rien. C'est où pour $10 000. Oui, mais gros track là dans mon sign, $10 000 pour se venir bailler là pour 3 jours. Dans mon sign là. Book d'elle commencer là, dans télémétrie, $7 000 oui, pour 3 jours.
Oh my God, Debbie, we gotta make it. We gotta make it.
Okay, but for nous pas courir pour une question. Now, read the question we are doing again to go deep on the question. Now, pas de monde qui ka battu dans tic douloureux. Parce qu'on est up and down. Let's go read it again.
When providing care for a client with trigeminal neuralgia, tic douloureux, which nursing action would best support the client's nutritional needs? A. Offer small meals of high-calorie soft food. B. Assist the client to sit in a chair for meals. C. Provide additional servings of fruits and raw vegetables. D. Encourage the client to eat fish, liver, and chicken.
Now, Debbie, what is your answer? Femi Debbie. Really back. Debbie?
Can I call her back?
I kept saying, well, can you guys hear me?
We didn't hear you.
Okay, read the question again. Read the question again, please.
Okay, yes, I'm here.
Read the question again.
All right, I'm going to read the question. When providing care for a client with trigeminal neuralgia, tic douloureux, which nursing action would best support the client's nutritional needs? A. Offer small meals of high-calorie soft food. B. Assist the client to sit in a chair for meals. C. Provide additional servings of fruits and raw vegetables. D. Encourage the client to eat fish, liver, and chicken.
What is your answer, Debbie?
A.
Based on what?
What we just learned.
Darling, based on what? What is your answer, my love?
A.
Based on what?
Yeah.
The chewing. Put it there.
Yeah.
Chewing. Parce que ça va répéter encore. This patient have trouble with chewing, touch the face, pain, and what else?
Touching, pain, and facial pain.
Facial. Darling, but when another, back once I work on them now.
Facial pain,
Chewing.
and touching.
So guess what? Ou besoin de food, ou pas vle mastiquer. Parce que le mastiquer, le chewing, c'est problème. So we avoid the mastication. Ou pas soft food, quelqu'un just faut to masticate tout petit swallow. Why not be? Read B for me, please. Read the question and read B. Darling, read the question for me, please.
Okay. When providing care for a client with trigeminal neuralgia, tic douloureux, which nursing action would best support the client's nutritional needs?
Okay, so now, puisque I parle de nutritional needs, I go back to the pathophysiology of the disease. Tic douloureux, chewing is the problem, touching is the problem, and facial pain. One side of facial pain. So I need my face to be comfortable. I need to have my chewing with no problem for me to be able to chew. So if I cannot chew, depuis moi chew my pain, I need some food. B, why is not B? Why is not B, my love? Read the answer B. Read the answer B. What is the answer? Read the answer for me, B. Upeji?
Oh, me.
B, yeah, read the answer B.
Assist the client to sit in a chair for meals.
Okay, it has nothing to do with tic douloureux. They didn't tell you tic douloureux have to sit on a high chair. No, we're talking about pain. We're talking about the patient unable to chew. We're not talking about positional. You should eliminate that right there. Elimination. You put not appropriate. Lo li question encore ou li answer ou kebe lan tête ou yo di moun ki fait tic douloureux si pose chita non chaise straight pa ge OK côté yo di si pose nan chaise straight là li rete nan zo bra tête ou.
Okay.
C. What is the answer for C? Tell me the answer.
Provide additional servings of fruits and raw vegetables.
Est-ce que tu raw vegetables si ba ki ba bouy ki di moun de ke problème chew? Si you do boiled vegetables, well cooked vegetables, moi t'apprends parce que les soft, les mous, ou était hello, ou même un plus mou so pas comprendre. Ou dit que ça, monde qui fait tic douloureux depuis on bagay dit pas ka moun l'a souffrir pirate, ou vegetable baboui, il pas ka answer. Mettez le bon côté. If you was soft, you know what? You see what they said raw vegetable? Darling. Mettez soft vegetable. Darling, ba ko sa pou fel? Ba, Corneille. Raw vegetable dit no. Soft vegetable. Mettez vegetable. C'est quoi ça fait pour comprendre?
Okay.
Okay?
And then the next one.
Okay, so now, what is the next one?
Encourage the client to eat fish, liver, and chicken.
Why not liver?
Because it's hard.
Liver is hard. Why not chicken? Bones are hard. You buy do boneless chicken. Soft. Everything has to be soft.
Okay.
So put your answer next to it. Just have them do it something else. They're not soft. Just put it has to be soft. We're talking about soft food. So now, tic douloureux, you know, t'allez bien, oui? Mon ado facial pain.
Facial pain.
What nerve guide the facial? Is it the cranial nerve? Look, no, Rachelle. Look what cranial nerve. What cranial nerve, if damage, could cause pain in your face? Cranial nerve, which cranial nerve, if damage, could cause pain in your face? Pourquoi ça m'a étudié, non?
Which?
Tout le monde qui passe avant, était passé de l'autre côté, ah oui? Mais comment ça?
You want Pee-wee? Fifth cranial nerve.
Darling, please, Pavin's fifth cranial nerve. Reroute it.
Okay, I'm sorry.
No, tell me exactly. No?
Okay. Tic douloureux or trigeminal neuralgia affects the fifth cranial
What
nerve.
is the responsibility of the fifth cranial nerve now? Put tic douloureux, attack the fifth cranial nerve. Mettez là, chérie.
Okay.
Responsible for sensation.
Darling, please. Et bien, ça n'a pas les gounia. On a fait l'autre bagaille. Tic douloureux is the cranial nerve, the fifth cranial nerve. Si board of nursing mando, not tic douloureux. Qui nerve qui attaque? The facial nerve, which is the fifth cranial nerve. Now you want to know the responsibility. Dans nous comme étant ça, ça veut dire qu'on va mal étudier. Ou ka écrit ni là ni là. Hold on, faut attendre avant. L'entendez ou learn, l'entendez ou absorb, l'entendez ou assimilate. Then ou lire ou écrire. C'est comme ça mon learn. The fifth cranial nerve, when no patient de tic douloureux, is the fifth cranial nerve was damaged. The fifth cranial nerve now, nous besoin connaître pour qui ça fifth cranial nerve là qui fait tout danger ça. What is the fifth cranial nerve? Responsibility. Now, fifth cranial nerve, fifth cranial nerves. So now, what is the fifth cranial nerve? Darling, mettez plus mon là pour l'île. Ou pas besoin de mon l'île pour. C'est pour l'île pour qu'à comprendre. The fifth cranial nerve is responsible. What is the fifth cranial nerve responsibility? Sensation. Darling, please read it. Darling, please, pas de monde qui écrit pour l'île. The fifth cranial nerve.
The fifth cranial nerve, the trigeminal nerve.
Aye! Now the other name for the fifth cranial nerve is the trigeminal nerve.
Trigeminal nerve.
Yes! Si vous connaissez comme ça, on pense que c'est tic douloureux qui là. Okay, so soyez calme, vlo explain it to me now.
Okay, the fifth cranial nerve is responsible for sensation of the face.
Pas de monde qui dit ça, non? Et bah, ça me dit, non? L'irresponsable, c'est ça, on va étudier mal, chérie. The fifth cranial nerve is the trigeminal nerve.
The fifth cranial nerve is the trigeminal nerve.
Ça veut dire, when you have tic douloureux, is the fifth cranial nerve who's responsible. Let's go.
The fifth cranial nerve is trigeminal nerve.
Yeah, also known as the trigeminal nerve.
The fifth cranial nerve is also known as trigeminal nerve.
Yeah, parce que dans tic douloureux, c'est fifth cranial nerve là qui damage.
Tic douloureux, the fifth cranial nerve is damaged.
Also known as what?
Trigeminal nerve.
That's all. Let's go. Okay.
Oh boy.
So which?
Pas dit moi chérie ou m'bap journée encore non?
No, tic douloureux or trigeminal neuralgia affects the fifth cranial nerve, the trigeminal nerve, which
Darling, keep on reading.
Which is responsible for sensation in the face. The condition involves
Hold on. So that means now we know the fifth cranial nerve in your face, which is the trigeminal nerve, is responsible for sensation. So sensation that veut dire the touch. Remember if you touch?
Pain, severe pain.
Okay.
Okay.
Okay. What else? Keep on reading. Go back, my love.
Tic douloureux or trigeminal neuralgia affects the fifth cranial nerve, the trigeminal nerve, which is responsible for sensation in the face. The condition involves episodes of severe stabbing facial pain, often caused by a blood vessel pressing on the nerve. Keep reading.
That's all you need to know. You know, and trigeminal or the tic douloureux is the fifth cranial nerve that involved with damage, and the fifth cranial nerve is responsible for sensations. So, if it's responsible for sensation, they said, what happened? Why the patient is in such a pain? It's because there's a blood vessels that compress. Read it again.
Tic douloureux or trigeminal neuralgia affects the fifth cranial nerve, the trigeminal nerve, which is responsible for sensation in the face. The condition involves episodes of severe stabbing facial pain.
Okay, that means this patient put tic douloureux, patient reports stabbing pain in the face. Pour le well, pour qu'à connaître ça parler. Si nous pas faire comme ça, on va responsable nous parler, non? Pas qu'on pourrait comme monde comme ici.
Reports severe.
Parce qu'on dit que ça monde qui est tic douloureux, ali dit que ça son monde qui sorti avec un couteau qui po dans face. Même j'ai qu'on a ki, yo même son couteau c'est go. or stabbing pain.
Which
Let's
is
go.
often caused by a blood vessel pressing on the nerve.
Ok, ça veut dire nous avons fif crânio nerve là. Qui ça fait mon vin get tic douloureux? C'est parce que fif crânio nerve là qu'on blood vessel qui nous dégage, li press against the nerve, il fait nerve là pas qu'à faire travail. Simple as that. Continuez avec les questions, s'il vous plaît.
Blood vessel.
Darling, si vous mettez dans un langage, qui ça tic douloureux, c'est fif crânio nerve là qui baille sensation dans figure qui fait les nègres beau sentir dans ciel là, c'est lui-même.
Okay.
So puisque gon blood vessel qui dit trop jalousie dans moun dame, oh fils ça crânio nerve ça fait prend trop feeling m'a bloqué et puis il bloque. The blood vessel compress against the fifth cranial nerve who's responsible for sensation et puis qu'on y a une douleur, même don pas ka bosser, don saisi, même figure pas ka manger, même chewing ou pas ka chewing.
Okay.
Next.
The affected nerve. The fifth cranial nerve or trigeminal nerve provides sensation to the face with three main branches. Pain from tic douloureux is most frequently felt in the areas supplied by the second maxillary and third mandibular branches of the nerve.
That's it. You don't need to know all of that. So we're not if I don't remember
Okay.
by say by mon by science, no science. See, no. Okay, next. We question encore. Then go back to the question now. Read it again.
Okay. When providing care for a client with trigeminal neuralgia,
What do you want to underline?
trigeminal neuralgia,
Underlining. What do you know about trigeminal neuralgia, please?
is tic douloureux. It's also known as tic douloureux.
Mm-hmm.
It affects the fifth cranial nerve called trigeminal neuralgia.
Okay, so
And it
combien,
is
combien,
symptoms.
3 symptômes, écris dans tête symptômes yo. Mettez trigeminal, mettons en flèche. Mettons, ou gagne déjà chez, mettez flèche là pour dire ça lié 3 symptômes. C'est comme ça rentre dans ton mon bébé.
Symptoms.
What is the one?
Facial pain,
Écris, facial pain. 2,
chewing,
okay, 3,
touching.
touching. So, quand on connaît 3 symptômes, ça est au gain. C'est avec ou marcher. C'est sensation. Si les sensations, les bougres de l'eau, on saisit ou on vient qui ça. Si on ne peut pas manger ça, ça passe.
Malnourished.
Ou malnourished. Dehydration. The questions.
Next question? Or the
Continue all the questions pour écrire tout ça pas bon dans la question. Assurez pour rester pour dire oui, mais pour qui ça go with C. Tell me what C said.
provide additional servings of fruits and raw vegetables.
Ou pas mettre pas raw vegetables. Ou pas additional food, soft food, 8 meals. Ou pas 8 meals a day. Soft portion of food a day parce que li pas kachou ou vle pour get tout calorie. 6 to 8 meals a day. Mettez là. Next to that C, put 6 to 8 soft meal a day. C'est ça, c'est ça, pas bon. Végétable pas bouilli. Dans ça, oh, mon.
It's raw.
Okay, what about D?
Encourage the client to eat fish, liver, and
Liver
chicken.
tellement dit. Ou pas comme ça, est-ce que le fish là, il bouilli, il consomme? Non, il pas. Depuis pas les sauf là, il pas. Okay, next question, please.
18. A surgical nurse has been reassigned to the pediatric unit. Which child being at the greatest risk for cardiac arrest should the charge nurse avoid assigning to this nurse?
So, I want you to underline the most important words.
Okay, I'm gonna underline a surgical nurse first.
What you gonna underline next, Debbie?
Reassigned to the pediatric unit.
Pediatric units. What is reassigned? Pediatric units. Read the question again.
A surgical nurse has been reassigned to the pediatric unit. Which child, being the greatest risk for cardiac arrest, should the charge nurse avoid assigning to this nurse?
Now, What do you think you should do in that questions? Read the question again.
Okay.
Read the question again.
A surgical nurse has...
So, what is the responsibility of a surgical nurse? Did they ever work in med-surg? Did they ever work in ER? No. So, now you got to read surgical nurse obligation, responsibility. Pour connaître qui ça ou ka fait, pour connaître qui gens pour y assign. Chérie, soit peut dit, ça c'est où même l'argent dehors, dégagez pour le faire. Okay, so read the question one more time.
Okay. A surgical nurse has been reassigned to the pediatric unit. Which child, being at the greatest risk for cardiac arrest, should the charge nurse avoid assigning to this nurse?
Why? Okay, now you need to know your surgical nurse, what they do. What they do. What surgical nurse does.
So the surgical nurse...
Read it, darling. It's something in your head, darling. You don't know it. What they do.
Okay, for the NCLEX, surgical nursing responsibilities involve the entire perioperative cycle.
Okay. You think they know when somebody's going to go to cardiac arrest? They don't know.
So pre-op.
They do pre-op. They witness the consent. What else they do?
Patient assessment.
Yeah, they ask the patient if they have any allergic to anything. They look at the IV side. Mm-hmm. They want to make sure the patient is well prepared to go to OR. What else they do?
IVs, meds, intra-op, maintaining sterility.
Sterilization, that's what they maintain.
Assisting surgeon.
Okay. Assisting the surgeon. They expect the patient to go into cardiac arrest in the surgery, but they're not responsible. The surgeon do all the things, and they're there. The anesthesiologist is there. They don't do shit.
Okay. Monitoring vitals.
Of course. So now, what patient you want to assign to that surgical nurse? Read the question again. Et ça fait me développer pas de ban nous réponse nous pour réponse nous copier nous pas connaître ça faire.
No,
no, that's not true. Okay, let's go.
I don't know. I do exactly what you're doing.
Okay, let's go.
Yeah.
Let's go. Qui j'ai fait que m'a fait question avec nous là, nous pas connaître là-dedans.
A surgical nurse has been reassigned to the pediatric unit. Which child, being at the greatest risk for cardiac arrest, should the charge nurse avoid assigning to this nurse?
Okay,
A. Congenital cardiac defects.
Mm-hmm.
B. Acute febrile illness. C. Prolonged hypoxemia. D. Severe multiple trauma.
What's your answer?
C is my answer.
Based on what?
Because
what is C to begin with?
prolonged that's trouble breathing.
Okay, so now.
And that can lead to cardiac arrest.
Okay, now go to A for me. What is A?
Congenital cardiac defect. So the child is born with that.
That's it. That's the way I want you to think. That's something chronic. We could fix it, but the child born with it. Mm-hmm. We have time to fix it. Mm-hmm. You could fix it 6, 12, I believe 18 months. We have time. Mm-hmm. That means it's a chronic situation. Yes. Any med-surg nurse could follow that child. Mm-hmm. Why not B? With B answer for me.
An acute febrile illness.
Okay, acute febrile illness. Why you think acute febrile illness is not the answer? Because the patient, what is acute febrile? Hold on. What is, hello? Shut up, motherfucker. What is acute febrile illness?
It's like fever.
The patient have a fever. Can we give Tylenol? Of course. Can we bring the fever down? Yes. So, we have Tylenol available. We have Motrin available. The doctor have to prescribe it. Mm-hmm. See?
Prolonged hypoxemia.
Hypoxemia, what's the patient is having? Low what? Low oxygenation. If you're not oxygenated, what's gonna happen? Your heart gonna say, woo! Your heart gonna say, ooh, where's my food? Where's my nutrients? Which is the oxygen. And the heart will feel hungry. And then if you're not very sharply administer high flow oxygen, you're having a death in your hand. What about D?
Severe multiple trauma.
Severe multiple trauma will be into trauma room. It's not a surgical nurse. You're not going to assign. The charge nurse does not assign. That's a trauma level 1 right there. Mm-hmm. So they will call the hospital. We have a multiple trauma coming in. We're going to, alert the whole ER. The whole hospital will be in the alert. And every nurse, we have the trauma team. We have the attending for the ER. We have the nurses in the ER. And we have designated nurses who's assigned to trauma. And the charge nurse will make an announcement. It will say, Senat to the trauma room, Senat. It will say, Linda to the trauma room. So this is not a surgical. You're not going to assign. You cannot assign a surgical nurse to trauma. You cannot. Mm-hmm. They don't know. Next question.
Okay. When administering client teaching about chlorpromazine.
Okay, now I want you to look at this medication. This is a medication. Look it up. Look it up. Why they're giving it. Look it up. Where that medication gonna be metabolizing? You want to know all of this.
Okay. So,
darling, look it up to yourself. I didn't ask you any questions, please. That's the way you do question, okay? Mm-hmm. If you do 100 questions like this, you're ready for the board. You have to do. I was gonna give you guys some pictures to study for the board. I'm not giving it today because apparently it doesn't do your work. Because you wanna go and kill this shit. Mm-hmm. Bim, 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 and done. Yeah. That's what you wanna do.
That's my dream.
Yeah, but you have to follow the rules. Dream comes with rules.
Yeah.
Okay. Do you have any answer for the medication?
Okay. Chlorpromazine. Is also known as thorazine.
Put it next to your chlorotizine, nambukla. Listen, what you see in the book, put a flash up. Put also known, darling. Also known equiloleale, also known as thorazine. What they use thorazine for?
Antipsychotic.
Also known as thorazine, period. Now, we're going to go here, put thorazine, antipsychotic. Okay? Now you want to know the mode of administration, things like that. So that's how you know your medication, by doing questions. Mm-hmm. When you see something you don't know, you look it up.
Yes.
Courir après pour 10,000 questions pour savoir chita d'assaut dans le nursing machine. Okay, so read the question again, darling. Put your telephone down, baby.
When administering client teaching about chlorpromazine, also known as thorazine, which substances or activities should the nurse instruct the client to avoid?
Okay, how do you come up with your answer? It's something for that. But how do you come up with that answer?
Oh, we looked it up.
Look it up where?
On the phone.
Everywhere?
Yeah. That's what we did. Yeah.
Okay, so based on what you choose, A, whatever you choose. Based on what? No, darling, you look it up already. Based on what? You should know it if you look it up.
The activity that you can do is it has photosensitivity. It's a side effect, so they have to avoid sunlight.
That's good news. But at the same time, I think, why they giving it for?
Oh, for bipolar.
So now, why is not there? To as in giving for, look it up now. I'm showing you, I want you to do 20 questions next week.
Okay.
20 questions. You guys have to have all the answers in the book for me.
Okay. Right.
Okay. So now look your Torazin. How they administer it? IM, IV, PO, how they administer Torazin?
Guess what, Marie?
Mm-hmm.
We already did 40 questions.
Torazin. Ou fait yo comprendre le minimum, but you have to know tout devant et derrière, comprendre?
Oh, you already did 40 questions? I'm still on the ones from before.
Yeah.
Oh, with Crystal.
Et pas question pour faire, c'est Jounen question en fait là pour faire.
Oh, you did some by yourself?
Non. Pour y a moi vle faire Jounen m'a fait là. Parce que j'aime faire là où il y a 10 questions dans chaque grande question. So I'm chercher la petite.
I'm trying to look for the indication.
Okay, so about indication, I'm asking you the board of administration of Torazin. That's all.
Oh, okay.
That's exactly what I'm asking you. Darling, I'm not asking for indication. I'm telling you it's the mode of administration I'm asking for. How they administer that medication? IM, IV, PO? How?
Oral. It says chlorpromazine has been administered via oral, tablets, liquid concentrate, intramuscular IM injection, intravenous IV injection, or infusion, and rectal suppository.
That's it. That means now you're going to put a note. Torazin could be administered oral. Let's go. Torazin, darling, put Torazin, chérie. Ou type toi, chérie, écrit là. Ou tu type toi, Torazin. Administer oral. Pas mal, parce que je vais comme ça.
Okay.
I don't mean anything. I just want you to get it. I want you to go there and nail it.
Administer.
Hold on. Hold on, hello, ma'am. Hello?
I remember you at my brain.
Yeah, okay. Torazin, administer 1 orally.
1 orally.
2 rectally.
2 rectally.
3 IM.
3 IM.
4 intravenously.
Intravenously.
We said only
liquid.
Liquid and also liquid. You could. They have a liquid form. It's also come in a liquid form.
Yeah, we said orally. That's PO.
Orally, rectally, liquid is PO too. Orally, rectally, IM and intravenously. The only go with it again.
Okay. Chlorpromazine can be administered via oral tablets, liquid concentrate, intramuscular injection, intravenous IV injection, or infusion and rectal suppository.
Rectal suppository. I want you to put next to this. Okay. So here, you see, orally, rectally.
Mm-hmm.
Darling, ou pas mette ou pas ligne. Même pas comment on vle. M'pa kon pour ça courir. Ou mette rectally. What is that, Lynn?
Suppository.
Rectally suppository. I don't know. Okay.
I don't know.
What is that? I am
intravenously.
And what else?
Liquid.
And you missed something.
Infusion.
Really. Infusion. Ça veut dire you can buy IV continuously. The only way we cannot give Torazin is sub-Q. So now put never administer sub-Q, which is SE.
Never.
Because you badi là.
Administer.
Sub-Q. M'ba le faire même parce que m'bouquet. Nous fait m'ba le trop parce que tout ça m'explique nous va faire. C'est ça nous supposé. Et pour ça m'ba et 175 $ mon m'en fait m'ba li. Parce que nous te fait 3 semaines nous pas venir, on fait là que li pas faire.
Okay.
Pour pas et vraiment vendre ça. L'autre jour, 3500 $ de toucher non et comment il engame ce vrai moment pour lui vous acheter. So, moi, bah, nous, moi, dis nous écrit la donne. C'est parce que moi, pas fait de review pendant 3 semaines. Moi, feel là que nous supposons comprendre comment nous vérifier. On a les questions encore.
When administering client teaching about Thorazine.
What, don't you want to highlight client teaching? Mettez dans big circle. Côté, me demandez pour tenir un crayon rose. Côté yo. Côté crayon vert, non? Vous comprenez? C'est pour ça étudier, bébé. Ouais, pendant faire 100 questions, vous avez toutes diseases. Il y a des gens qui ont. Mais puisque vous avez écrit, oh oui, c'est dormir pour dormir dans la chaise qui est pour qui ça? Il faut expliquer pour qui ça va dormir dans la chaise qui est.
Can we meet sometime this week with you again? Maybe like one day for at least 1 hour to do some questions again, please?
Okay, you guys let me know when. Sometimes I'm home after 10.
It's hard this week for me. Oh my God.
After 10.
Oh, after 10? So
give us 1 hour after 10 p.m.?
Oh,
no, we can do it on the phone after 10 p.m.?
Yeah.
Okay, that's good. I can do that.
So, yeah, let's go with the question now. You guys responsible to do 10 questions. And everybody is responsible to do it the way I'm doing it. And I'm going to call you guys in Tuesday night. You guys have to tell me. I'm going to ask question. And all of us are adult. They have strike in Mount Sinai, $10,000 for 3 days. They have strike coming up in Albany and California is $17,000 for a week. So let me tell you guys, there's money out there. So let's hurry up. Let's hurry up. You could drag your kids in the summertime, tell them you're going to see Bonnie. You take them with you on vacation. You have one maid stay with them for 3 days you work. And the 4 days you have, you explore the world with them. There's money out there. Okay?
She's telling the truth, Debbie.
There's money out there. There's a lot of money.
No, Marie's gonna help us make it. Don't worry. Marie, all my hope is in you. I hope you know that.
Yeah,
Me too.
Yeah, your hope is in me, but you have to do what I tell you to do.
Me and Debbie, we tried. And Crystal tried too. It's just, the schedule is different. We have so much going on. I have 3 kids.
Let me tell you something. Review. I'm the only person who do review until I know you get it. Nobody do it this way. Everybody tell you it's 5 days, 6 days, 1 week, and they leave you.
Yeah, that's true.
Me, I hold your hand. And I told you when you're ready. If you want not go before me, that's your business. But when you're ready, you're ready. Okay. Read the question one more time. We're going to do 2 more questions.
When administering client teaching about chlorpromazine HCl, also known as Thorazine, which substances or activities should the nurse instruct the client to avoid?
So, what they giving Thorazine for?
For bipolar, schizophrenia.
So, I want you to put that next to it. Thorazine administered for bipolar, schizophrenia, and what else? Darling, put Thorazine up there. You don't want to mix your shit because you want to read it later. Okay. Thorazine usually giving for bipolar, schizophrenia. What else they give Thorazine for? You guys study?
So we did it. We didn't do it the same way.
Come.
That you asked us.
Thorazine given for bipolar, schizophrenia. Darling, nous pas mélanger à fort, entendez?
Okay.
C'est qu'on s'en fait. Thorazine administration, ou connaît comment il administre, you put it in tank.
Okay. Yeah, it says it also is given for nausea and vomiting.
Yes.
Intractable.
That's what I want to hear. They give it for intractable hiccups. You know what? We had somebody on Facebook. His name is Lovamix who have that hiccup. So if Thorazine don't, cure that hiccup, is cardiac. So usually you gotta put the same Thorazine given for bipolar, schizo, and intractable hiccups.
How you spell intractable?
Intractable. You don't give a shit. You're gonna say hiccup.
Okay.
For hiccups, for nausea, vomiting, and what else?
Nausea, vomiting.
What else?
Is there anything else, Debbie?
Bipolar 1, acute mania.
Maniac, acute maniac. Put it in there, darling. Acute maniac. Now you know they give Thorazine for nausea, vomiting, intractable hiccups, so bipolar, schizophrenia. So now you have a ensemble pour qui ça va pour tout le monde ça.
Yes.
So you gotta accumulate that. Thorazine is given for schizo, bipolar, nausea, vomiting, intractable hiccups, and also they give Thorazine for maniac.
Okay.
Let's go. Now, where is your hiccups?
Over there.
Hold on. Move your hand down.
Oh, Marie, I have one question too.
Mm-hmm.
Are we gonna do EKG?
Darling, please. You're not even there yet, please.
Okay.
Of course, we're going to do everything. You going to pass your board, no?
Okay.
Ah, baby. Nous pouvons lâcher. La fin avec comment pour faire question yo, m'gon l'autre livre question m'a ban encore. Moi pense nous tap move forward a little bit faster.
We've been doing it.
No, nous pas faire le jam, moi dis nous on faire là. Read the question again. Now Debbie Avid is different. Now she will be able to guide you, you'll be able to guide her. She'll say, I understand what Mary said, this is what I heard. You understand?
Yeah.
Next.
Yes.
When administering client teaching about chlorpromazine, HCl, thorazine, which substances or activities should the nurse instruct the client to avoid?
Mm-hmm.
A. Direct sunlight. B. Foods containing tyramine. C. Foods fermented with yeast. And D. Canned citrus fruit drinks.
I'm going to show you a little tricks. So now, we know Thorazine is for schizo, bipolar, mania, nausea, vomiting, and hiccups.
Mm-hmm.
So tell me C. Read C answer.
Foods fermented with yeast.
Did they say anything about yeast there?
No.
Cannot be the answer. What about D?
Canned citrus fruit drinks.
Did they say anything about citrus there? No. So now I want you to go back and look at Thorazine. Do you need to wear a hat when you give some patient Thorazine? If the patient is on vacation, do the patient need to wear a hat because of sunlight? Is Thorazine sensitive to the sun? If you know that, you must be able to answer the question.
So thorazine. So thorazine side effects and class?
Darling, no. Thorazine sensitivity.
Oh.
Thorazine sensitivity in class.
Livre ou supposé look that way, darling. If tu pas écrit dans le livre là, ou avec écrit dans le cahier, il peut pas marcher. Parce que c'est question, c'est chaque réponse ou questionner. Chaque question ou questionner réponse. Ou bien de prendre examen en seule fois, ou fini. T'en vas pas de prendre ou manquer là.
Yeah, I took this exam 5 times.
Okay, what is Thorazine, darling?
In the context of NCLEX, sensitivity to thorazine primarily refers to adverse and life-threatening side effects such as neuroleptic malignant syndrome and severe orthostatic hypotension.
Okay, Thorazine cause hypotension. Put it there. Thorazine cause hypotension. Darling, put it next there. Écris là non, on cahier, on connaît. Thorazine cause hypotension. Of course, yes. Hypotension. Ou écris dans next question après. Hein?
No, right here.
Mais question, chérie, c'est là pour écrire la question. Ils sont pas dit en bas là.
This is where it is, right here.
Et là, sont les questions?
Yeah, that's what
Et pour ça là.
I didn't have room.
Ok, wap mal joué. Ok, Thorazine, ok. Est-ce que, ask them, those people use Thorazine, is Thorazine sensitivity to light? That's what you want to know.
Yes, thorazine chloromethylene causes significant sensitivity to sunlight.
That's it. Keep on reading.
A reaction known as photosensitivity.
Photosensitivity. So that's all you need to know. Now you're going to put that. People that take thorazine, listen to me carefully.
Mm-hmm.
When you have somebody who's taking thorazine, your job is to teach them to wear a hat or carry an umbrella or wear sunglasses. Reason because thorazine is sensitive to light. It could cause photosensitivity. So I comprends what you dis.
Okay. People who
Moun wap bay thorazine nan wap explique parents moun nan. Si parce que pas oublier nous dire ka bay thorazine oli, ça veut dire m'ka voye au patient la ka li nan thorazine. So si m'ka voye la ka nan thorazine, faut m'capable di maman ou bien papa ou bien ou même. Pas oublier la thorazine nan le soleil dehors, mettez chapeau dans tête ou. Depuis que le soleil dehors, mettez aux lunettes soleil parce que thorazine get photosensitivity. Mon sa yo, y a développé photosensitivity. Ou pas vle plus exposed to sunlight.
Okay. So with thorazine, you have photosensitivity, so to go home with a
What is it?
to wear. If you have a patient taking thorazine and they
Only at home.
At home, tell them to wear a hat.
Yes, or sunlight. Both of nursing will give you the sunlight or the umbrella chapeau qui protège you from sunlight.
Yeah, to avoid sunlight.
And then plus, how are you going to tell them to store the thorazine? Away from light, in a dark bottle, in a brown bottle, because they are sensitive to light. You know what?
Yeah. Right, Debbie? You got
Yeah,
it?
so store it in a brown bottle, right?
Darling, a brown bottle or a dark bottle.
No, a dark bottle. Okay.
Yeah, parce que ou pas vle light là, destroy médicament. Parce que ça a des photosensitivity, c'est ça qu'on dit, vous mettez chapeau dans la tête, ou bien vous mettez en lunettes en soleil, you know? Ok, chaque question, oui.
Glasses, hat. Known as thorazine, which substances or activities should the nurse instruct the client to avoid? A. Direct sunlight.
Aïe, aïe, aïe.
B. Foods containing tyramine. C. Foods fermented with yeast. D. Canned citrus fruits.
Do you know what to do now? Because, what is your answer?
The answer is A.
What is A?
Photosensitivity.
Photosensitivity. What is B?
Foods containing tyramine.
This is what we want to say. What dit thorazine pa jam gen problem avec a food qui gen tyramine.
Okay.
That's how you know it. Ou dit si thorazine pa gen problem avec fermented food qui gen yeast. You learn it. Ou dit thorazine pa gen problem avec canned citrus food. You gotta put it every time. Put thorazine. No problem with this. Thorazine, no. You gotta eat real stuff. You understand?
Okay, I see.
Yes. C'est pour dire tout ça pour kéber dans tête tout. Tout l'air où je une question l'autre genre pour qu'avoir réponse ça. Thorazine pas de problème avec fermented food. Thorazine pas de problème avec citrus food. Thorazine de problème seulement avec sunlight. That's the way we study. Eh ben, ok, non?
No, yeah.
Do you understand it, Debbie?
Yes, I
Si nous va faire comme ça, il va marcher.
Okay. So, Debbie, we have a lot to do.
It's not a lot to do. You said it the wrong way. It's
To study.
next
that.
question.
All right, next question is.
So that means thorazine, hold on. Debbie,
Yes,
qui moun yo bay thorazine, please.
Antipsychotic, bipolar, intractable hiccup, and nausea and vomiting.
Qui jan yo bay li?
I am. Okay, you give it every way but sub-Q.
That's it.
Okay.
Even IV infusion, Soubaili. Met gomun sou. Ki sa pou di moun na pou kapotogazin la kalipiyo?
Avoid, but you have to put it in a dark bottle.
Ok. Le ap bagi na yi lan ou bien emergency room nan. Ki jan yo kouvri avec un brown bag, ok? Which is dark. Next question, let's go.
Okay, a nurse who is evaluating a developmentally challenged 2-year-old should stress which goal when talking to the child.
I want you to take your time, read that question and underline what you want to target in that question. Underline for me, please.
A nurse?
Darling, underline with yourself because you should be able to underline now.
Mm-hmm.
That's one of your goals. Okay. So read the question again in your mind. Read it avec un pile attention. Posez. Make sure look at your punctuation. Your punctuation is the key. Read your question again. You must let me read it for you so you will know. When you're reading the question. A nurse who is evaluating a developmentally challenged 2-year-old should stress with goal when talking to the child mother. I'm going to read it one more time. A nurse who is evaluating this developmentally challenged 2-year-old should stress which goal when talking to the child mother. Debbie, what did you underline?
The developmentally 2-year-old.
What else?
Did that.
What else?
Evaluating.
Evaluating is the word, darling. What else you underline? What do you underline, my love?
I underlined evaluating developmentally 2-year-old and goal.
Yes. You got a 2-year-old. Why the board of nursing is giving me an age? Is because they're talking to me. They want me to know this is not somebody who has the same age as me. They want me to know it's not somebody whose brain is fully developed like mine. Mm-hmm. They're talking about somebody who's mentally challenging, and they tell me that patient is 2-year-old. So read the question again.
A nurse who is evaluating a developmentally challenged 2-year-old should stress which goal when talking to a child's mother. A. Teaching the child self-care skills. B. Preparing for independent toileting. C. Promoting the child's optimal development. D. Helping the family decide on long-term care.
So now, what did you answer?
C.
What did you answer?
C. Promoting the child's optimal development.
Debbie, what's the answer?
Yes, C.
Okay, now, read the question again.
A nurse who is evaluating a developmentally challenged 2-year-old should stress which goal when talking to the child's mother.
Read it again. What do you think they're asking you in that questions?
I think they're asking like what's most important about the child developmental stage.
Okay, what do you think they're asking, Debbie?
I think they're pretty much telling you that what the mother should be what the mother has to do and expecting from a child.
That's it. That's it. So now, 2 years old fall under what category under Erickson? Now, where's your Erickson stage? The last time I told you guys to study. Yeah, toddler. The Erickson stage is toddler. What age to what age? Toddler is 2 to 3.
2 to 5.
2 to 5. Listen. Draw a line, toddler. A big line, darling. Big line.
Okay.
Darling, a big line, please. Put 2. Okay. Before 2, go this way. Okay. Put 18. So according to the Board of Nursing, toddler is 18.
2 years old.
How many months is 2 years old, darling?
24.
According to Board of Nursing, toddler start at 18 and is finished at 2 years old, which is 24. Listen to me, darling, do not write. Okay. Writing is not taking you anywhere. But according to Erickson, toddler is 2 to 3. According to Board of Nursing, toddler is 18 to 2.
Okay.
So if I was you, the line that I'm drawing, I'm going to put 18, I'm going to put a question mark, and I'm going to put 2, and I'm going to go to 24 right there.
Okay.
Put 24. I'm playing with 18 to 24. 2 years old to 3 years old. How much is 3 years old? Toddler is 2 to 3.
36 months.
36. Put 36 for me, s'il vous plaît. Toddler is 2 to 3. So according to Board of Nursing, toddler is 18 to 36. But we're playing with that parameters because we don't know where they're going to shoot. Because they're shooting. If toddler is 2 to 3, 18 to 3, I'm going to look at the question to see where they're heading, to see if they have that parameters. I know toddler is 18 to 3. Because preschooler is 3 to 6. According to Board of Nursing, preschooler is preschooler is 2.5 to something. So, but
I think it's 2.5 to 8.
Something like that. But we're gonna get there. So now we know the toddler is 18 to 3, 18 to 34. Or what we do, Board of Nursing will tell you is 18. 36. Pas qu'à 36 chérie 3 ans. 12, 36. Okay. So, read the question again.
A nurse who is evaluating a developmentally challenged 2-year-old should stress which goal when talking to a child's mother?
Okay.
A. Teaching the child self-care skills.
You cannot, because the reason you can't teach someone self-care skill is because they learn at their own pace. You got to put that in your mind. You know what is c'est raison ça. Si la maman vient koto, dit oh ti moun pa nan mes petites voisines nan gen des ans la marcher pa nan pa marcher. You tell them, every kid develop a different way. That's not your job. B.
Preparing for independent toileting.
That's not, no. When do you worry about? They could be 3 years old, they still don't go to the bathroom, they still shitting on themselves, peeing on themselves. It's a individual task. It's when they're ready. If the mother said, why Petit Gina la bathroom pour qu'on des ans et demi pas pour aller, it's an individual task. Go back, third.
Promoting the child's optimal development.
That's not your job. The child will go. Okay, what is C?
Promoting the child's optimal development.
Optimal development, ça veut dire que l'on prend weightly, highly, ou kabay feedback. Ou doit gagner encore café. What's the answer? Is C?
Yeah.
Okay, what is D?
Helping the family decide on long-term care.
Et pas business ou soit pas docteur. Et docteur avec spécialiste qui supposé réunir pour dire si mon a un problème.
Yeah.
Et pas business. So if I was you next to all those answers, qui pas vérité, m'dap dit that's not my job, et m'dap make sure m'songe answer ça au téléphone moi, m'dap répéter dans tête moi, et puis m'dit read les libé à moi.
Prepare for independent toileting.
M'dap dit that's not my job, chaque ti moun développer j'en vle, dit
helping the family decide on.
That's not my job. That's the doctor job. Et so mette next sur lui pour qu'à comprendre. Il faut lire question, il faut prendre les postes pour étudier comme ça. Next question.
Okay. 21. Upon admission of a 16-month-old child, the nurse enters the room for the first time. The toddler clings to the mother and begins crying.
I'm going to stop you right there. What is the age for toddler, please?
18.
Darling, if Debbie, what is the age for toddler?
18 to 3 years.
That's it.
Okay.
Because remember, it's not 3 years. It's before 3 years. But marché avec 18, actually it's 12 to 3 years old.
Okay.
Parce que FNC is 0 to 3 months.
Yes.
But of dressing the FNC is 0 to 12 months. So, ou gen en tête ou à 3 mois FNC fini, c'est toddler commencé.
Okay. Yes.
But, no, I'm sorry. Newborn commencé 0 to 3. Excusez-moi, virez pour me dire ça. C'est newborn qui 0 to 3. 0 to 3 mois, c'est newborn. Okay? 0 to 3 months is newborn. 3 months to 12 months is infancy.
Okay, I have that. Yeah.
Okay? And then 12 months to 2.5 to 18 months. 12 months to 18 months is toddler. But according to Board of Nursing, it could go up to 20 months. So you're gonna know by the end of this study, you're gonna know when to switch around.
Okay.
Let's go.
Upon admission of a 16-month-old child, the nurse enters the room for the first time.
16-month-old fall under what? Infancy, toddler?
Toddler.
It's a toddler.
Toddler. Toujours mettre dans tête ou là ouais yo, dit que ça 16 months. Read the question again.
Upon admission of a 16-month-old
A 16-month-old child which is a toddler. Ou tout gen nan oreille ou nan boîte tout li tout gravé là. Ou gamin sou li encore.
Upon admission of a 16-month-old child, which is a toddler, the nurse enters the room.
And what is the age for toddler? Age range.
12 to 18 months.
12 to 18, but you say some it could be up to 20. The Board of Nursing might say 18.
Yeah, because you know what? Preschoolers start at 3 to 6. So ça veut dire between 12 to 18 to 18 and a half. Depuis back arrivé 3 is a toddler. Let's go.
Upon admission of a 16-month-old child, also a toddler, the nurse enters the room for the first time. The toddler clings to the mother and begins crying. What should the nurse's initial action be? What should be the nurse's initial action? A. Arrange to change client care assignments. B. Explain that this behavior is expected. C. Discuss the appropriate use of time out. D. Explain that the child needs extra attention.
Okay. So now, qui sont comprendre dans ça li? Parce que m'pa comprendre on dit là. Moi me vle ou di m'so comprendre parce que ou lil. Moi même capteur li m'pa comprendre. What did you learn? Et ben m'pa la voir. What did you learn?
I learned what for the child's age, what should the mother expect from the
Okay,
child?
what did you learn, Debbie?
Okay, so you pretty much, when you go, the nurse wants you to know that a child at that age.
It's not the nurse, it's the Board of Nursing who's talking to you, darling.
Yeah.
Go ahead.
So what to expect from a
Ou kon ki wole mgen, le moun ap li ap explique ou tout li tout ki pa jom nan avantage.
what is not normal for a child at the age.
Read it again. Okay, thank you. Read it again. Both of you read it again.
I'm
Bo hello nan tête nou pou nou li. Pou kon. What's that? It's just really women to là. Oh mon Dieu. C'est
That happened today?
Today, pendant ma...
Oh.
Moi, les ouvert pour le frigidaire à ma GTA. Et puis, les voyaient cajons tomber et puis, il y a allé. C'est ça, c'est tellement content, je saisis avec ça. Là, les gars. C'est ça, je courir, regarder, nous sur mon tête, bois et bibliothèque.
Oh my gosh. Wow.
Okay, so it's yeah. So it's pretty much as a nurse when you walk into the room and the child starts acting like this, just you need to tell the mother this is expected.
Like acting like what? You gotta tell me so I understand.
Yeah.
Holding on to the mother and crying.
Okay, so now I want you to go back to toddler to see how they react to stranger. Look it up and put it in your thing. Darling, look at toddler and tell me how they react to stranger. That's how you study. Yeah, because if the child see you, they call at the mother. I know they're selfish. I know they play by themselves. They like to share. They want to grab it from them. They cry for others. You probably look
Okay, toddlers react to strangers with stranger anxiety.
Anxiety! That's all you need to know. Feminine. Toddler react to stranger anxiety. They scared. They crawl to their mother because they want to know who the fuck are you. Yeah, they crawl. They have toddler dogs have anxiety to stranger. When stranger try to grab them, they crawl, they run. And then toddler are selfish. Darling, cherche en ligne, vous mettez tout ensemble pour qu'on ait. Nous avec écrit sur vous mettez toddler. One, selfish. They don't share. They have stranger anxiety. They play by themselves. They don't want to share. They play by themselves. Period. That's toddler. Okay? Est-ce qu'on comprend?
Yeah.
Now read the question again.
While conducting... Oh, no.
Mettez un plomb à côté de lui, mettez toddler dans la tête là. Là, mettez toddler, et puis qu'on y a coloriel pour qu'on de qui sort parler. Mais gamin ça. Pas il faut me jouer un cadeau. Ma cabré dit que bonne vol. On pas qu'elle on pas qu'elle étudier Vinn là tout passer bas moi, on sait de mon valise un cadeau.
Me, I'm not like that. No, I'm not like that.
Oh, la chambre moi pas besoin de ça. You know, but also baga this one the carry les demander moi gen qui vient la caméra passer moi la faire réclame pour nurses programme foreign nurses non va fait mal comme ça si ça moi fait le cadeau computer moi fait le passer là vini moi ouais le foreign nurses si t'es capable arrêter le botter on fait des botter voler
Yeah. But me buying God.
Chaque jour, je regarde dans foreign nurses. Ça fait mal en plus parce que, oh, mon Mindel qui voit la caméra, Mindel voit. Là, il vient mal dans piscine check machin computer pour $1,500 pour le cadeau. Parce que il dit il sorti dans qui pays ça le organe. Moi sorti mon qui pour bagaille, maman le pas gain, fait le cadeau. Il passé qu'on y a moi la à l'école dans foreign nurses. Saisi ouais événement ça. But it's okay. C'est ok. Ouais, bon Dieu a toujours ouvert porte. Bon Dieu a toujours fait tout à fait marcher. Yeah. C'est moi tu fais dans foreign nurses là bien dans foreign nurses là $1,500 tu fais des Carmel qui toujours en bas live moi qui passe là tout. Carmel calé avec la piscine check la crédit 4 000 men. Qu'acheter computer a fait le cadeau pour $1,500. Mindel qui veut la caille. Il t'a cherché travail. Tout le monde dit c'est l'école pour l'aller encore. Mais elle dit non, je ne suis pas avec le mari dans le jeune. Mais elle t'a joué à comme on a
Her phone getting discharged.
La brûle encore. Mais d'elle a dit bêtise à un monde. Mais d'elle dit, oh oui, vini chérie, vini mal fait, me mettre sur le Marie-Sénat. C'est vu ça, moi, le forêt 9-6. On sait? Bon Dieu, ouais, Jésus qu'on a dit. Okay.
Yeah, that's not fair.
No,
No, that was you.
Me?
Yeah, I didn't touch anything.
Oh, that's weird. Okay.
No, you're too good, Marina.
Oui. Pas chambre pas donner manger. C'est si vraiment pas ça.
Yeah.
Et puis je le cherche. Ok, oui, chérie. En tout cas, continuez. Moi, juste, comme si c'est mon qui réfère mon avec. Mon réfère mon. Et comme ça, avant Covid, nous avons 20-25 moun là. Je viens quitter mal travail plutôt parce que je ne peux pas amener mon là quand même Covid.
Yeah.
Quand il y a moi commencé. Ok, so, t'as qu'on y a là, puisque on a parlé de toddler, je vais chercher qui game toddler joue.
Okay.
The game, what they play, toddler play. Parce que tout connaît, et puis pendant marcher, on va jouer tout le monde.
Toddler.
Play. Qui ça au game? Qui game toddler play? I know they selfish, they play by themselves, they don't share. I know they, attendez oui, non seulement ils play pour compte you're curious. Il y a toujours foué doit être une barre électrico, c'est ça qu'il faut supposer bloquer tout le bagage ça. Regardez-vous.
For the NCLEX, toddler play centers on parallel play, playing alongside others without direct
Yes, you pas interact with they center. That means they focus on themselves. What they play, center play. Go ahead, little chérie.
Centers on parallel play.
Ok, mettez là toddler play. Mettez deux bords. Center and parallel play. Regardez ça au jour là. Ça veut dire jouer pour compte yo, mais faut que des amis en sous côté yo. Amis a jouer avec a fait parler et puis les arrêté on est levé à ramasser jouer des amis on met.
Yes. Says enjoying push, pull toys, blocks.
Darling, oui, encore. Ma m'bap douce encore. Bouquet.
For the NCLEX, toddler play ages 1 to 3 centers on parallel.
They said 1 to 3, 12 months. It's not 1 year old. 2 3, but it's 1 to 18 months.
Okay.
Pour board of nursing, but nous aller 1 to 3, but nous connaît board of nursing c'est 18 months and it target premium.
Okay.
You understand? Est-ce qu'on gagne la caille chérie?
No, I
Okay.
18 to 36. That's 1 to 3.
Darling,
18
chérie,
months.
moi je pay attention. Toddler, lis ça encore attendez ça audio.
Toddler play ages 1 to 3.
1 to 3. You même là bien 18 ans, côté toddler play là. Ouais, on va faire un autre chérie mbaka ido.
Right here, toddler play.
Ah,
This
vas-y.
is the question. Toddler play centers on parallel play.
Chérie, c'est là jambe d'eau, ça m'a cherché là.
Oh, let me.
Côté on mettre la déjà là pour retourner.
Right here,
Qui ça me répéter?
12 to 18.
So qui ça vous dit là même?
1 to 3.
Mettez 1 years old en bas. Ou connaît trois là c'est 1 years old, but still mettez 1 years old. 1 years old, chérie, mettez 1 years old là pour qu'on s'en parle. 1 years old to what?
2,
18
3.
months.
2 3 years old.
Okay.
Okay? Also, vous connaissez 18 months là. C'est pas ami, there's also may use 18 months. Also may use 18 months, okay?
Okay.
Est-ce qu'on comprend?
Yes.
Alright, let's go. Continue.
Centers on parallel play.
You play center and
Parallel play.
yeah, toddler qui play au jeu center and parallel play.
Playing alongside.
Darlene, est-ce qu'on écrit center and parallel play?
Yeah.
Okay, continue.
Playing alongside others.
You'll
without
play
direct-
alongside, you pas play avec each other. Ou ka chita là, you play. Alongside. C'est comme ça, bon, de si n'a pas avec question.
Without direct interaction.
You pas interact avec no one. You interact avec tech, you. Chérie, écrit le genre, you dit là là.
Without direct interaction.
Darlene, moi, v'lo, l'offre écrit ça, m'v'lo li so écrit, parce que c'est pas ça, moi, écrit. On allait.
Toddlers play centers on parallel play without direct interaction.
Mm-hmm. Okay.
Okay. Enjoying, push.
Okay, now, kick, what kind of game they enjoying? Push.
Push and pull toys.
Push and pull toy. Toddler enjoy push and pull toy.
Joy.
Push and pull toy.
Push. Pull. Toys. Block and pretend play.
Block. You gonna kiss a black building tika you. Black and what else?
Pretend play.
And pretend play. So now we're gonna have to go to more detail with the pretend play. Pretend play, you probably have a game na you parle a lot more. That's what it is.
It says mimicking household activities like cooking.
Aïe aïe aïe. Yo chita la, yo tout ça mon affaire, yo mimic you cooking. They mimic you mapping. They mimic you sweeping. They mimic the house. They mimic what?
Household activities.
Household activity. Mimic household activities like mapping the floor. Mimic household activity like mapping the floor. Oh, suka na mitakala guye too. They mimic. What are they do? They're crazy. I love. Now you know when you're reviewing those questions, you know to review all of this and it's stick in your head. Keep on reading the question.
Okay. Upon admission of a 16-month-old child, the nurse enters the room for the first time. The toddler clings to the mother and begins crying.
What do you think is that when he claimed to the mother?
He's scared.
Anxiety.
Anxiety.
With He's scared of you. Blood, I'm scared of you. Motherfucker.
Anxiety.
Yeah, that means is because you see, toddler have stranger anxiety. Okay?
The toddler clings to the mother and begins crying.
That means is toddler stranger anxiety. Of course, if they have anxiety, they're gonna cry. Okay, keep on reading.
What should be the nurse's initial action? A. Arrange a change client care assignment.
It's not gonna work because that's part of their growing thing. B.
Explain that this behavior is expected. C. Discuss the appropriate use of time out. D. Explain that the child needs extra attention.
So what's your answer?
B.
Is expected because we learned from Erickson, we learned from Maslow that toddler, that's the people that study high class. They told us toddler has stranger anxiety. When you try to grab them, they locked into their family and they mimic us. They're very selfish. They play by themselves. They do parallel play. They don't play with each other. And then they selfish. They will grab. If they see, they don't share. Remember that toddler don't share. If they see the other girl is playing with a doll and then taking a courant, that's the reason we need to cut them. We need security. Safety is a major issue. Because, what you going to do for toddler? Because they're exploring. Yeah. They go all over. They see mommy. They mimic household. They see mommy take an aspirin every morning. They wait. You go upstairs. They take aspirin as candy. They eat the whole bottle. They become overdose. That's the reason you have to have your cabinet locked and a locking key. The insert in the board of nursing, not only lock, he has to be locked with a key. If you don't see the key, that's the only answer is lock. But make sure you look to see if there's a locking key. And then, your household, things to clean your detergent, they should be locked on the keys because they're going to drink it. And you're going to have a problem. Because they're exploring. They're young. They don't know. And then if they see you cleaning with the same bleach you're cleaning, they're going to drink it. That's the reason under the bathroom, your cabinet must be locked. Because they're going to drink it. Because they're exploring. Let's continue on reading.
What should the nurse's initial action?
Darling, but I don't understand. You gotta read the question.
Upon admission of a 60-month-old child, the nurse enters the room for the first time. The toddler.
Okay, what do you want? Okay, tell me what you will underline on this question. Read the question and tell me what you're gonna underline. As you read, underline for me, please. Let's go.
Upon admission of a 60-month-old child, I'm gonna underline 60-month-old child.
Okay, 16 months. You don't need anything else. Mm-hmm.
Then
Keep reading. Keep on reading. Don't use this yet. Keep on reading.
the nurse enters.
Keep on reading. Go back.
Okay. Upon admission of a 60-month-old child, I underline 60-month-old, the nurse enters the room for the first time.
What you gonna underline, please?
Enters the room for the first
Darling, you're not gonna be able to underline everything. First time. That's what you're gonna underline. Underline first time. What else?
The toddler clings.
Darling, keep on reading.
The toddler clings to the mother and begins crying.
Crying. Toddler and crying. Toddler. Go read the question again. I'm gonna tell you why.
Upon admission of a 16-month-old child, the nurse enters the room for the first time. The toddler clings to the mother and begins crying.
That means they show you now. They said toddler have anxiety. First time. The toddler never see that nurse before.
Yeah.
He is scared. Here, mommy, they come to get me. First time. First time the toddler see the nurse. First time. He claimed to his mother for security. Toddler anxiety. Because that's the first time the toddler see that nurse.
Yes.
That's toddler anxiety.
Okay. What should the nurse's initial action?
Okay, based on your knowledge, you know toddler, they selfish, they play by themselves. It's shame versus what?
Doubt.
You know why is shame versus doubt for toddler?
Yeah, the fear of strangers.
I'm asking why is shame versus doubt? Because when a toddler is exploring, you said, hey, get out of here. They go in a corner, they cry because they shame. You embarrass them.
Yeah.
Now you make them scared. You make them not want to explore anymore.
Mm-hmm.
Because they know by exploring, when they get it right, their self-esteem busts.
Mm-hmm.
But you gotta be very alert to make sure that you protect them from danger.
Yes.
So now read the question again.
Upon admission of a 60-month-old child, the nurse enters the room for the first time. The toddler clings to the mother and begins crying. What should be the nurse's initial action?
Okay, what do you wanna underline now? Initial. Why? Because I already know about toddler. I already know how they feel. I already know who they are. I already know what to expect. Now, initial, what you will do?
A. Arrange the change client care assignment.
No, that's not a problem because we know it's anxiety versus stranger.
Explain that this behavior is expected. C. Discuss the appropriate use of timeout.
No, timeout for what? You're gonna give them timeout, but not in this situation.
D. Explain that the child needs extra attention.
No, because this is the only thing that overpower everything is because that's one of their norms as toddler, anxiety versus strangers. When they see a stranger, their level of anxiety went wow. What's your answer?
B. Explain that this behavior is expected.
It's normal. If I was you, next to B, I would put toddler stranger anxiety. B, darling, put your flesh, you know what you're talking about. Toddler have anxiety towards strangers. Now, tell me why A is not the correct answer.
Because it's not.
Read the A, darling. Read the question and read A again.
Upon admission of a 16-month-old child,
What is the age for toddler?
12 to
12 to 18
18.
months.
It could be 12 to, is it 1 to 3 or 12 to 18 months?
12 to 18 or 20.
12 to 18 or 20. Okay.
Read the question, darling. Read the question back.
Upon admission of a 16-month-old child, toddler, the nurse enters the room for the first time. The toddler clings to the mother and begins crying. What should be the nurse's action?
Why do you think the toddler is crying? Why?
Because the stranger is scared.
Stranger anxiety. They're scared of stranger. They look for the mother for comfort.
Yeah.
All right. So A,
Arrange to change client care assignment.
just do yourself a favor. Put no. It's just darling. Put a flash. Bab Julian Koshiri.
No.
Okay.
No.
They have stranger anxiety. Read the question, with the answer, and put it in your mind. If you see the same answer someplace else, you don't choose it.
Okay.
What is the answer?
No, they have.
Darling, what is the answer?
Oh, the answer is they expect this behavior.
Darling, what is it? Read A for me, please.
A. Arrange to change client care assignments.
That's not. When you finish reading, you said to yourself, that's not the answer because they have stranger anxiety. B.
B. Explain this behavior is expected because the child has stranger anxiety.
That's it. C.
Discuss the appropriate use of timeout. No, that is not the answer because the toddler has stranger anxiety.
Anxiety, okay? Mm-hmm.
Explain the child needs extra attention.
D. Darling, please. D.
D. Explain the child needs extra attention. No, that is not the answer because the child has stranger anxiety.
Anxiety, because that's the first time the child see the
nurse.
That's it. Next question. That's the way to study.
22. While conducting routine exams in a well child clinic, the nurse assesses several toddlers. Which toddler should be scheduled for further follow-up?
Okay, what you gonna underline, please? Read your question again and underline. Read it loud and underline for me.
While conducting routine exams,
Darling, read the question, please.
While conducting routine exams in a well child clinic, the nurse assesses several toddlers. Which toddler should be scheduled for further follow-up? Okay,
so now go read the question and underline for me and tell me what you're going to underline as you read it.
While conducting routine exams...
You don't need routine exam. Keep on reading again.
While conducting routine exam in a well child clinic...
Well child clinic. Why? They're not talking about hospital. No. They're not talking about clinic. They're not talking about a nursing home. Why they tell me it's in a well child clinic?
Because it's about...
Darling, please, read the question.
While conducting routine exams in a well child clinic, the nurse assesses several toddlers. Which toddler should be scheduled for further follow-up?
Mm-hmm. A. Remember, the key words is well child clinic. Listen, a well child clinic is not an emergency room. Mm-hmm. It's a doctor's office or a clinic. They have little access, minimal access. We in the hospital have access. We could intubate. We could save lives. They cannot. They could see what's going on. They could refer you back to the hospital. They could call the ambulance if it's a life threatened. Nothing else. Read the question again.
While conducting routine exams in a well child clinic, the nurse assesses several toddlers. Which toddler should be scheduled for further follow-up? A. A 13-month-old unable to walk. B. A 20-month-old only using 2 to 3 word sentences. C. A 20-month-old who cries during examination. D. A 30-month-old only drinking from a sippy cup. Okay, so now read the question again and I'm going to stop you. While conducting routine exams in a well child clinic, the nurse assesses several toddlers. Which toddler should be scheduled for further follow-up? A. A 13-month-old unable to walk.
Now I'm going to stop you. What is toddler age, please?
1 to 3.
Toddler age.
And a month. I want it in months. I'm not talking to you, Debbie.
12 to 18 months.
It could be 12 to 24 months.
12 to 24.
Darling, put it in your notes. Darling, go back to where you have it, okay? Go back, because you have it somewhere. You write it. It's in the back.
Yeah, 12 to 18.
Put it 12 to 18 on the bar, 24 months. Okay, me go on through. Let's go. Okay, so now every time you find a toddler, remind you the age, remind you what they play. Parallel play, they selfish, they don't want to share, they exploring the mimic household. We need to lock all the cabinets, the cabinets, the medicine cabinet, the cabinets under your sink in the bathroom. This is where your detergent is at, because they're going to drink it. They high risk for poisoning. It's not here, you gotta put it down. Toddler high risk for poisoning. Darling, put it somewhere relating to toddler and any question you have toddler. This question, hello? Qui dernière question gen la gen toddler la, yes or no?
Yeah, this one.
Okay, then put it. Toddler high risk for. Darling, écris.
Yeah, toddler at
High risk for poisoning. That's the reason we need to make sure all the cabinets are locked in. Or Latin, because they mimic household, they're gonna map, they're gonna drink the Clorox while they're pouring the Clorox on the floor. Mm-hmm. They're gonna drink it.
Okay. While conducting routine exams in a well-child clinic, the nurse assesses several toddlers. Uh-huh. Which toddler should be scheduled for further follow-up? A. A 13-month-old unable to walk. B. A 20-month-old only using 2 to 3 word sentences. C. A 24-month-old who cries during examination. D. A 30-month-old only drinking from a sippy cup.
What is your answer?
A.
Okay, so now do process of elimination. So now, a toddler now, you need to know how many words a toddler should speak. Look it up.
Oh, okay.
Yeah, they tell you how many words they should be speaking. What is your answer, Debbie?
The one with the sippy cup, D. A 30-month-old only drinking.
Okay, when you do that, you must go to each question and question the question. Why is not the correct answer? You learn from that and you move forward, okay?
How many words?
How many words a toddler should be speaking? I think it's nine specific words.
It says 2 to 3. At least 2 to 3 words.
Okay, darling, please.
Like 2 to 3.
Darling, make sure you put how many words a toddler should be speaking in English. Thank you.
Okay. For English prep, remember, toddlers have big jumps. 2-year-olds use 50 to 250 words and 2-word phrases, more juice.
Darling, you wrong.
No?
You're in the wrong place. I don't know what you put. Let me see what you put for your search.
Yeah.
You gotta go up here and then here you 50 to 300 word vocabulary. They have 50 to 300 words vocabulary. And they're supposed to use 2-word phrase.
Okay.
Okay, read it to yourself and make a note in the bottom. Here, make a note about toddler. Read it to yourself, assimilate it first, and then copy it, darling. Okay.
2-year-old.
Darling, e pa copier le word, non? C'est pour assimiler dans tête ou expliquer me nigonia.
A 2-year-old should have 50 to 300 words if they have two word phrases. If they have less, then they're a late talker and should be evaluated by a speech pathologist.
E so suppose qu'on est tout notion. Bon, quitter nous là, parce que nous faisons pas plus d'efforts là.
Oh.
Nous va apprendre par eux, je ne sais pas apprendre. T'as dit ça, ça c'est mal à faire.
Speak 50 to 300.
Yeah, 50 to 300 words, but they have to have 2 words phrase. You say, mommy, milk.
Word.
Yes. Mommy, pineapple. Mommy, cereal.
Not need. Lead talker. By speech therapist.
Okay.
Okay.
So now, Kounya, est-ce que nous pensons que faut nous ta review tout ça ou qu'on tout job toddler, ça toddler fait, you selfish, qui l'a gêné, qui l'a eu t'a supposé party train a toddler? Let's go. When do you think they should party train a toddler? Hello?
At least,
No? When they're ready. When they're ready.
Oh, when
There's
they're
no
ready.
party train date for them when they're ready.
Okay.
They could be 3 years old, they're still peeing on themselves when they're ready.
When they're ready.
I think I'm going to stop right there.
okay, Marie.
What you looking for?
So you said we can definitely hear from you again on Tuesday night.
My friend, you need to do questions tonight with her. At least you got to do 5 questions tonight.
Okay.
Do it the same way I did it. And then tomorrow night, I'm going to call you guys at 9 p.m.
Tomorrow night? Okay.
Okay.
Let me know the 5 questions you do tonight. We're going to review them together.
Okay.
Make sure you do your note the same way you did your note now.
Okay.
Okay, thank you.
Okay, so what time are we gonna meet tonight?
Darling, don't worry about that. Do your question. I'm going to call you tomorrow night at 8:30.
Okay, tomorrow at 8:30.
8:30 tomorrow.
We'll have 5 questions tomorrow. That'll be
You better do the 5 question tonight and look everywhere for the answers. Why A is no good? Why B is not good? Why C is good?
Okay.
Yes,
By
yes,
doing
that's
this,
right.
you will know 20 questions, 100 questions.
2, 3, 4.
Yes.
Et bien, ça, bon, ou alors, font question, on fait 20 questions. Et là, nous va fort. On fait 20 questions.
Okay, so it's like if every question builds.
Pas oublier, on va jouer une table puis devant. On va jouer un tic douloureux puis devant. Chaque ton joint ni, ou je n'ai pas d'explication, ou déjà connaît nous Dieu sa similitude.
Okay. Okay. It's gonna be a lot. It's gonna be a long journey, but we're gonna make it.
It's not a long journey. You just have to apply yourself.